Order. Good morning, everyone. I hope you had a good break. Today, our subcommittee marks up 4 bills that will save lives and save patients money on their prescription drugs. Committee will come to order, please. Shh. First, we're going to consider 2 bills that will save the lives of new mothers. We had, I think, highly instructive hearings on this issue and learned that each year 700 American women die and 50,000 women are severely injured due to complications related to childbirth. For African American women in the United States, it's even more dangerous to give birth. They are 3 times more likely to die from childbirth than white women. This is really a shocking statistic, and it's unacceptable. It's also preventable, and that's what the bills that we're taking up deal with. The CDC estimates as much as 60% of these deaths could be prevented. Our first bill will fund and authorize data-driven approaches to inform healthcare professionals about the best practices and protocols to manage a mother's care in an emergency, such as when a mother hemorrhages after birth. It will also improve the quality of care that rural mothers receive. This work has been spearheaded in my congressional district. Stanford's California Maternal Quality Care Collaborative has reduced severe health problems from pregnancy-related hemorrhages by 21% and has contributed to reducing the maternal mortality rate in California by 55%. So I'm very proud that our subcommittee is going to vote today on a bill to expand this model nationwide, and obviously I encourage every colleague to support it. Our second maternal health bill recognizes that to make real progress, women must be able to get medical care when they need it. That's not exactly earth-shaking, and one would assume that that was built into the system, but it's not. Women are more likely to die of a pregnancy-related condition in the weeks following birth than during pregnancy or delivery, but many mothers in America lack health insurance during that critical postpartum period. Every year, thousands of mothers are kicked off of Medicaid only 2 months after giving birth. So today we're considering a bipartisan bill to give states the option to extend postpartum Medicaid coverage for 1 year. And I'm pleased that our Republican colleagues support this policy, but I also recognize that we have to continue to work to ensure the Medicaid safety net is there for women at this vulnerable time in their lives, no matter what state they live in. Our third bill takes aim at the leading cause of preventable death and illness in the United States. Chairman Pallone and Representative Shalala's Reversing the Youth Tobacco Epidemic Act extends restrictions on tobacco marketing, on sale, on flavor restrictions, and fees to e-cigarettes, while also making the landmark change of raising the minimum age to buy tobacco products to 21 years. This bill will save lives. Raising the tobacco age to 21 will result in 250,000 fewer premature deaths for those born between 2000 and 2019. This is strong, comprehensive legislation that will reverse youth e-cigarette use and drive down youth tobacco use overall. Most importantly, it closes loopholes that tobacco and e-cigarette manufacturers have exploited for years to target young people and African Americans, including predatory marketing of sweet flavors and menthol products. We can't allow young Americans to be ensnared in a new addiction. We also can't ignore the disproportionate and deadly impact that menthol flavors have had on the African American community. During our subcommittee hearing on this bill, I think there was a lot of conflation between e-cigarettes and THC vapes. On November 8th, the CDC identified vitamin E acetate, an additive commonly used in THC vapes, as the, quote, very strong culprit in the vaping-related lung injuries. So let's be clear, in December 2018, months before the outbreak of the vaping deaths, the Surgeon General said that there's an epidemic of youth e-cigarette use. He said, and I quote, "We must take action now to protect the health of our nation's young people." That was 11 months ago, and that's why I urge my colleagues to heed his advice and take action now. Finally, we continue our bipartisan work to lower the cost of prescription drugs. The Stop Games Act lives up to its name. It stops the games that are played to prevent cheaper generic drugs from coming to market. So I think it's time to do everything we can to stop these preventable deaths from tobacco use and maternal injury, and urge my colleagues to support the bills. I now recognize Mr. Burgess, the ranking member of the subcommittee, for 5 minutes for his opening statement.
And I thank the chair for the recognition, and we are here today to discuss 4 bills that deal with different public health issues with which our country is faced. 2 important bills increase on the Health Subcommittee's commitment to addressing maternal mortality and build on the success of Jamie Herrera Butler's H.R. 13, the Preventing Maternal Deaths Act, which was passed in the last Congress and signed into law by President Trump last year. Representative Robin Kelly and myself introduced H.R. 4996 with Representatives Underwood, McMorris Rogers, Presley, and Carter. The Helping Medicaid Offer Maternity Services Act of 2019 provides for a state option under the Medicaid program to provide for and extend continuous coverage for pregnant and postpartum mothers for 12 months after birth. Currently, most states provide coverage for only 60 days, and there is an expanding volume of literature pointing to the benefits of having that coverage for 1 year after delivery. This bill provides a state option to provide for continuous coverage for full benefits for women who are or become pregnant. States have already indicated a willingness to address maternal mortality rates, and H.R. 4996 will allow states to increase these efforts in their Medicaid programs if they so choose without disrupting their current work. To further encourage states to utilize this extension program, those who participate will receive a temporary 5% increase in their federal medical assistance percentage for the first year after implementation. We heard from Dr. David Nelson of Parkland Hospital at our hearing in September how important it is for hospitals and clinicians to engage in best practices to ensure the health and safety of mothers before, during, and after birth. To that point, I appreciate the inclusion of H.R. 4995, the Maternal Health Quality Improvement Act of 2019. And I thank you for including it in this markup, and I thank Representatives Engel and Bouchon for their work on this legislation. H.R. 4995 will establish the Health Resources and Service Administration grants for collaborative improvement networks to address gaps in maternity care and maternal morbidity and mortality, particularly in rural areas. This builds on the bill from last Congress, the Improving Access to Maternity Care Act, H.R. 315, which identifies maternity care health professional shortage target areas and was signed into law last December. These provisions are paired with a section focusing on innovation for maternal health that is taken from Dr. Bouchon's H.R. 4215, of which I am an original co-sponsor. This provision will enable collaboration among clinicians, public health officials, researchers, and community organizations to develop and share best practices for maternal health. Both H.R. 4996 and 4995 are a step in the right direction in addressing maternal mortality, and I would like to thank members on both sides of the dais for their ongoing commitment to this issue. Protecting mothers is an important goal, as is protecting our youth. Today we will discuss Chairman Pallone's tobacco bill, H.R. 2339. I share concerns about the effect that certain products have on our nation's youth. I also have concern that parts of this bill go too far. The bill includes potential infringement on the First Amendment by requiring warnings on cigarette labels and advertising. There are other ways to educate individuals about the harmful effects of smoking without infringing upon the freedom of speech. Additionally, this bill is not going to adequately address the lung injury that the Center for Disease Control and Prevention are currently investigating. CDC's most recent findings provide direct evidence of vitamin E acetate within the lungs at the primary site of injury, and they're continuing to evaluate other compounds. I also have concerns with H.R. 2387, the Stop Games Act of 2019. Citizens should have the right to petition their government, and I'm willing to negotiate to get this language to a place where it can be acceptable, but limiting the time that a citizen has to file a petition to 60 days when there currently is no deadline may be too limiting. We did not have a hearing on this bill, and I'm not comfortable with supporting the language as it currently stands, but I hope this will begin a dialogue and we can find a way to work together before the full committee markup. So I do look forward to passing these bipartisan maternal mortality bills out of committee today. I would like to see changes made to the other two bills. With that, thank you, Madam Chair, and I'll yield back.
The gentleman yields back and now recognize the chairman of the full committee, Mr. Pallone, for his 5 minutes.
Thank you, Madam Chair. Today, the Health Subcommittee will address the leading cause of preventable death worldwide, and that's tobacco, as well as the public health crisis of maternal mortality and morbidity. The subcommittee will also continue to work to reduce drug prices by tackling the abuse of citizen petitions at the FDA, and all four of the bills we're marking up have some level of bipartisan support. First, we will consider my bill, H.R. 2339, the Reversing the Youth Tobacco Epidemic Act. Every year, cigarette smoking causes 480,000 deaths in the United States, and an additional 41,000 people die due to exposure to secondhand smoke. And while the U.S. has made progress in cutting down on youth tobacco use after passage of the Tobacco Control Act in 2009, in recent years we've seen a dramatic uptick among young people due to the rapidly growing popularity of e-cigarettes. These products often carry flavors like mint, menthol, mango, and cotton candy to attract children and teens and then hook them with extremely high doses of nicotine. As a result, youth tobacco use has reached epidemic proportions. In the last 3 years alone, e-cigarette use amongst high school students has more than doubled to 27% this year. If smoking continues at its current rate, the Centers for Disease Control and Prevention estimates that 5.6 million American youth under the age of 18 today will die prematurely due to tobacco-related illness. And we simply can't allow this to happen. Congress must act now to avoid losing another generation to tobacco-related illnesses and premature death. H.R. 2339 adopts a comprehensive approach to ending this epidemic. The bill raises the minimum age to purchase tobacco to 21. It prohibits flavors in tobacco products, including mint and menthol, two of the most popular flavors among youth. It bans all non-face-to-face sales of tobacco products and protects kids from predatory marketing. Collectively, these actions will prevent millions of deaths and bring us closer to ending the public health scourge of tobacco once and for all. Now, the subcommittee will also move two bills to address the maternal mortality and morbidity problem. CDC estimates that about 700 women in the United States die each year from pregnancy-related complications, and thousands more face severe maternal morbidity. When you compare those statistics to other countries around the world, the U.S. ranks near the bottom. And the U.S. is the only country in the world with a rising maternal death rate, and it's really shocking and I think inexcusable. I'm hopeful, though, that through our bipartisan work, we can begin to counter these disturbing trends. The Maternal Health Quality Improvement Act, introduced by Representatives Engel and Bouchon, will authorize and improve a number of public health programs to address this crisis head-on. It incorporates provisions of Representatives Torres Small's Rural Moms Act to address health outcomes and access to care in rural areas. And it incorporates legislation from Representative Alma Adams to educate health professionals on how to prevent discrimination in care, including how to recognize and address implicit and explicit biases. These provisions are critical since African Americans and Native Americans in particular are 3 times more likely to die from pregnancy-related conditions than others. We'll also consider H.R. 4996, the Helping Medicaid Offer Maternal Services Act, or the Helping Moms Act. This bipartisan legislation, again, in this case led by Representatives Kelly and then Ranking Member Burgess, would allow states the option of extending Medicaid coverage to 12 months postpartum. And this would benefit a lot of families since Medicaid and CHIP pay for nearly 50% of all births. Babies born to mothers receiving Medicaid or CHIP are automatically eligible for coverage for the first years of their lives, but many women's eligibility ends 60 days after giving birth. And this disrupts care and creates gaps in coverage during the critical first year postpartum. This bill would help ensure that women are able to have uninterrupted coverage and access to care in the first 12 months postpartum, which is proven to improve health outcomes. And then finally, we're considering the Stop Games Act of 2019, again bipartisan, introduced by Representatives Levin and Rooney, that will help address the abuse of citizen petitions that delay or impede generic drugs from coming to market. This legislation enhances FDA's authority to swiftly dismiss anti-competitive petitions. The policy has bipartisan support in the Senate and from the Trump administration. It's just another step in this committee's work to remove barriers that prevent cheaper generic drugs from coming to market. Madam Chair, these are all important bills that will help us improve health outcomes and access to care, and I hope they'll all garner bipartisan support. And thank you again for considering them today. I yield back.
The gentleman yields back. It's a pleasure to recognize the ranking member of the full committee, Mr. Walden, for his 5 minutes of.
Good morning, Madam Chair.
Good morning.
And thank you for having this markup today. We are marking up, as you've heard, 4 bills addressing public health issues ranging from improving maternal health outcomes to regulating e-cigarettes to reforming the citizen petition process at the Food and Drug Administration. I'm very pleased we've worked together to advance the maternal mortality bills in a truly bipartisan fashion. Last year, the President signed into law the Preventing Maternal Deaths Act. This important law, led by Representatives Herrera-Butler and Representative DeGette, improved data collection and reporting around maternal mortality and developed systems at the local, state, and national levels to better understand the burden of maternal complications. So today we build off that work by marking up H.R. 4996, which is the Helping Medicaid Offer Maternity Services, or MOMS Act, and H.R. 4995, the Maternal Health Quality Improvement Act. Now, the Maternal Health Quality Improvement Act, led by our Energy and Commerce Committee colleagues, Representatives Engel, Bouchon, and Latta, combines provisions of the 2 important bipartisan bills. First, H.R. 4215, the Excellence in Maternal Health Act, which was led by Dr. Bouchon, authorizes grants to identify, develop, and disseminate maternal health quality best practices, supports training for health professionals, and authorizes grants for operating innovative evidence-based programs that deliver integrated services to pregnant and postpartum women. And second, H.R. 4243. The Rural Moms Act, spearheaded by Representatives Torres Small and Latta, specifically helps improve maternal health in rural areas, which is really important in districts like mine. H.R. 4996, the Helping Moms Act, led by our Energy and Commerce Committee colleagues Kelly, Burgess, Carter, and Rogers, enhances coverage for pregnant and postpartum women in the Medicaid and S-CHIP programs by giving states the option of covering pregnant and postpartum women for a year instead of 60 days, and that's what's available under current law, the 60 days. So both of these bipartisan bills demonstrate the commitment of this committee to continue to address maternal mortality and improve the health outcomes in expectant or new mothers across our nation. H.R. 2387, the Stop Games Act, introduced by Representatives Levin and Rooney, aims to get generic drugs to market more quickly, and while I support the goals of the legislation, I do believe that, as currently drafted, this bill raises some serious constitutional concerns, Madam Chair. So I hope to continue working with the Chair in an effort to address our concerns before proceeding to a full committee markup. And finally, we'll be considering H.R. 2339. This is the Reversing Youth Tobacco Epidemic Act, and I think we can all agree that the youth vaping epidemic is a serious crisis. I also think we can agree that the vaping-related illnesses that have swept across the country over the last few months has been equally of concern. However, this bill will not do anything to prevent future vaping illnesses such as the ones we've recently seen, and that's disappointing. We all want to prevent the use of tobacco products by minors. The upward trend in adolescent use of e-cigarettes in just the past 3 years is alarming, and the use of these products by children is particularly troubling, since we know that most e-cigarettes contain nicotine, an addictive substance the CDC has warned may harm brain development and increase risk for future addiction to other drugs, and may lead to the use of other tobacco products. There are several aspects of the chairman's bill that our side could support. Cracking down on youth tobacco use is a laudable goal, and we're committed to working with you to stop this epidemic. But there is another agenda at play here to completely rid the market of all flavored tobacco products. Smoking is harmful, and we should do what we can to prevent use by children. But I think eliminating consumer choice for law-abiding adults is unnecessary and will lead to unintended consequences. We heard in this committee last month that those who choose flavored products will go out of their way to get them. Illicit tobacco trade's already a very real problem across the globe, and a complete ban on flavored and menthol products will only open up new opportunities for the counterfeit market and make these provisions worse. A complete ban on all flavored tobacco products could drive individuals toward illicit products, which pose substantially higher risk given that our regulators and consumers have no idea what dangerous substances they may contain. Additionally, this bill misses the mark on preventing vaping-related illnesses. It ignores the facts. The CDC has stated the majority of these illnesses have been caused by substances in illegal THC vape products. Yet this bill does nothing to address flavored marijuana products that are being marketed across the United States. While I appreciate the chairman's dedication, and I know he's sincere about this matter, we need to advance legislation that would have a clear impact on the challenge we all acknowledge, and that's curbing youth tobacco use. I'm disappointed that during our legislative hearing we're not able to hear from the FDA. The agency will be tasked with implementing the law, but I believe we can get this right. So on all of today's legislation, I look forward to working with you, Madam Chairwoman and Mr. Chairman, as we move forward in the process, and I yield back.
The gentleman yields back. Do other members seek recognition to make an opening statement? Who's next?
I move to strike the last word. Thank you, Chairman Pallone, Chairwoman
Just a
Ash.
minute, just a minute. I think in the order, Ms. Matsui is recognized.
Thank you very much, Madam Chair. The subcommittee is advancing essential public health and Medicaid legislation today, and I'm pleased that we're confronting critical issues facing some of our most vulnerable populations, youth, moms, and babies. Over the past several years, we've witnessed the Trump administration delay regulatory review of e-cigarette products. This inaction has had significant consequences. Our kids and teens are on the verge of a lifetime of nicotine addiction. We're only beginning to understand the long-term health consequences associated with the use of vapor products. To keep tobacco products out of the hands of America's youth, it is clear to me that we must enact new comprehensive legislation to fully address the growing epidemic. Today, we're taking a meaningful step to do just that. I'm also encouraged that this subcommittee is acting in a bipartisan way to improve maternal health. Keeping our mothers and babies safe and healthy is vital. Programs in my home state of California have targeted efforts at preventable morbidity, mortality, and racial disparities, and incentivize quality improvement activities that made a positive impact on rural and communities of color prone to poor maternal health outcomes. However, this work is far from done. As I said before, extending Medicaid coverage for maternal health services to 12 months postpartum is a critical next step, and strengthening quality measures and training programs for birthing services will help protect our mothers and babies when care is delivered. I thank my colleagues in committee for their work to include these vital policies on our agenda today. Thank you, and I yield back the balance of my time.
Gentlewoman yields back. From the Republican side, is there anyone that wishes to make an opening statement? No? Hearing none. On our side, no? The gentleman from California, Dr. Ruiz, is recognized.
Thank you very much for holding today's hearing and this markup and for addressing the urgent issue of the youth vaping epidemic. As a physician and public health expert, I cannot overstate the importance of policies that protect our youth from tobacco products, whether that is combustible cigarettes or vaping products. Neither is healthy. Both are addictive, and nicotine has no health benefit. Now we are seeing a youth vaping epidemic with severe consequences, not just the immediate consequence of the lungs basically burning up, but also having lifelong addicted youth to nicotine. Last week, I visited Zane in the hospital. He's a 15-year-old constituent from Desert Hot Springs who has been in the hospital for over a month because of a vaping-related illness. Zane first tried vaping at a skateboard park. After seeing his friends do it, thought it was cool. His friends offered it to him, and he said, well, I did it because it tasted like donuts. It tasted good. So 6 months later, he developed respiratory failure, requiring mechanical ventilations for his stiff, delicate lungs to keep him alive. Whether or not it's because the devices or the pods or the off-brand or mixed with products that they aren't intended to be mixed with, the fact is that vaping is not good for you. Yet vaping rates among teens continue to rise in alarming amounts. And we have to address this, and we have to address it now. Zane's story reiterated a couple of vaping-related issues that need to be addressed. First, there was a lack of awareness among both teens and parents on the dangers of vaping. His mother thought that because it was safer than cigarettes, that vaping was safe. Second, Zane told me the exact store that would sell him and his friends vaping products. Zane told me that it was easy for them to get the products and that he bought them himself at 15 years old. That's why I've been writing a bill that would crack down on retailers that are selling tobacco to underage kids, a bill that would increase research so we can understand how to educate the community about the dangers of nicotine use with kids. The bill would also HHS to study the perception of the harmful effects of vaping. Additionally, it will help address the severe lung consequences that we're seeing now if we simply reduce risks of youth getting their hands on products. So banning flavors, increasing the age, all that will definitely help this epidemic, not only of youth vaping, but also what we're seeing with the damages to the lungs. Additionally, I'm working on a separate bill that would make it tougher for kids to hide vaping devices, because, you know, they sell them now like USB cards and little toys, and it's hard for them, for teachers and people to identify what they are. So I'm not offering these amendments today, but I'll continue to work with staff and in a bipartisan way with some of my colleagues on the other side to address this issue for Zane, his family, and all the other youth that are now becoming addicted to nicotine and suffering the severe consequences of respiratory failure because of it. Thank you.
The gentleman yields back. Is there anyone else that wishes to make an opening statement? Yes, the gentleman, my friend, Mr. Lujan, is recognized for 5 minutes.
Thank you, Madam Chair, and I want to thank Chairman Pallone, Ranking Member Walden, Chairwoman Eshoo, and Ranking Member Burgess for today's markup. Today we're taking action on legislation that is critical to the health of my constituents in New Mexico and Americans across the country. These bills will take important steps to reverse the terrifying trends in youth tobacco use, e-cig use, and maternal mortality. I'm a proud co-sponsor of Chairman Pallone's bill, the Reversing the Youth Tobacco Epidemic Act, which prohibits the flavored tobacco and e-cigarette products that are designed to appeal to young people to get them hooked for life. That is especially important for my home state, given that Native American adults and young Native American friends and neighbors both have a higher smoking rate than any other subgroup. 24% for adults and 19% for high school students, compared to 15% for white adults and 10% for white high school students. This legislation also raises the minimum age to buy tobacco products to 21, making it more difficult for high school students to purchase e-cigarettes for younger children. Madam Chair, there's also some attention that needs to be brought to why this is important and why we should be using every tool to stop this. There were a few articles that highlighted what Juul was doing. In April 2017, a Juul representative visited the Dwight School in New York City to meet with students with no teachers present and told them the company's e-cigarettes were, quote, totally safe. In Richmond, California last year, Juul gave the Police Activities League $90,000 to offer the company's vaping education program, quote, moving beyond, to middle school and high school students who face suspension for using cigarettes. Juul then went to present to Native American communities. In one instance, offering to sell starter kits valued at $50 to the tribe for $5. The tribe would then provide the starter kits to patients who enroll in the switching program, a program established by Juul, saying that this was a safe product. Everything that we can do to stop this, we must do, including the targeting to children, targeting to communities, misleading people, lying to people. Someone's got to be held accountable. And I'm certainly hopeful that we can get this done together, Madam Chair. I'm also proud to support legislation that's coming forward that we worked on. I want to thank Robin Kelly for her leadership and what she's done. I want to thank Congresswoman Toda Small, who introduced the Bipartisan Rural Moms Act. The bill, which is included in the Maternal Health Quality Improvement Act we are marking up today, expands access to maternal health services in rural areas by increasing the availability of telehealth. With that, I yield back, and I encourage my colleagues to support these bills.
The gentleman yields back. Is there anyone else that would like to make an opening statement? The gentlewoman from Michigan, Ms. Dingell, is recognized for her opening statement.
Thank you, Chairman Eshoo and Ranking Member Burgess, for bringing us together to move legislation that's going to get at some of the most important health issues facing our country today. The legislation before us today, all bipartisan, will help strengthen maternal health and drug companies' gaming of the FDA approval process to block competition and address the youth tobacco epidemic that's one of the defining public health crises of our time. As we heard in September's Health Subcommittee hearing, postpartum depression and mental health issues are serious, and they demand our attention and compassion. It is great to see bipartisan legislation to help extend the length of postpartum Medicaid coverage being considered today. And we've discussed at length the need to address high prescription drug prices. Cracking down on drug companies' gaming of the FDA regulatory processes must be a priority, and I'm glad to see my colleague from Michigan, Congressman Andy Levin, helping to address this important issue through the Stop Games Act before us today. Reforms to address the youth tobacco epidemic are desperately needed, and Chairman Pallone's and Congresswoman Shalala's Reversing the Youth Tobacco Epidemic Act of 2019 legislation comprehensively addresses the drivers of this crisis. My colleagues have talked about many of these issues already. Tobacco use remains the leading cause of preventable death in the United States. Still today, when we know what we know, there are almost 500,000 deaths each year because of tobacco. And we are seeing unprecedented increases in youth tobacco and e-cigarette use. From 2017 to 2019, e-cigarette use doubled among high school students. Today, over 1/4 of all high schoolers have used cigarettes in the past month. Think about that, 1/4. Michigan has been hit very hard by this crisis. We have seen the devastating health effects of increased tobacco use and vaping every day. Last month, we saw the first one in the country. A 17-year-old boy in Michigan faced life-threatening complications as a result of the vaping that we've been reading about throughout the country, this vaping that is damaging, killing the lungs, and he had to undergo a double lung transplant to save his life. One of his doctors, Dr. Hassan Neme, said that the damage and the scarring to the boy's lungs was nothing he had ever seen in 20 years of practicing medicine. And this young boy would have faced immediate, certain death without this double lung transplant. It can't continue. The crisis is here, and it's a public health emergency now. As Dr. Neme said, this senseless type of product needs to be fought. And he looked at me and he said, action is required now. He isn't just listening to other people talk. He has seen those damaged, dying lungs. I urge my colleagues to take this action and support the Reversing the Youth Tobacco Epidemic Act of 2019 to address this public health crisis. Thank you, Madam Chair, and I yield back.
The gentlewoman yields back. Is there anyone else that wishes to make an opening statement? Ms. Berrigan, the gentlewoman from California, Ms. Berrigan, is recognized for 5 minutes.
Thank you, Madam Chairwoman.
3 minutes, I'm sorry.
Thank you, Madam Chairwoman. I had a town hall about a week ago, and it was quite remarkable to hear my constituents wanting to talk about the work that's being done on this committee. And I mentioned the issue of youth vaping, and there was a lot of interest in making sure Congress is taking action. So I am so pleased that today we are taking action and doing more than just talking about a problem, but taking steps to make sure we're addressing youth vaping and the marketing that tobacco companies have been doing to communities of color and children is really unacceptable, and it has been quite effective. We have seen a disparity among smoking rates. In Los Angeles County, while the adult smoking rate is about 13.3%, African American and Latino men are smoking at much higher rates of over 20%. Children are specifically being targeted, and the marketing is incredibly effective. For instance, a study found that African American children were 3 times more likely to recognize advertisements for the menthol brand Newport than any other child. The bill today will go a long way to help protecting children, including children of color, from getting addicted to products that may ultimately lead to them becoming sick and potentially dying. Additionally, our country is in a crisis when it comes to maternal health and maternal mortality. The United States has the worst rate of maternal deaths in the entire developed world. What's worse is women of color disproportionately face a higher level of pregnancy-related death. The Centers for Disease Control and Prevention found that Black women are 3.3 times more likely than white women to suffer a pregnancy-related death. This is unacceptable, and why I'm proud today to support these bills. These bills will authorize grants for innovation in maternal health, train health professionals to reduce and prevent discrimination, including explicit and implicit biases, and would expand access to Medicaid. I'm proud to support these bills and look forward to voting for them. And with that, I yield back.
Gentlewoman yields back. Anyone from the Republican side? Not seeing or hearing anyone. On the Democratic side, the gentleman from Illinois, Mr. Rush, is recognized for 3 minutes.
I want to thank you, Madam Chairman. Madam Chairman, in 2010, Congress took a critical step to address the maternal mortality crisis by including my bill, the Melanie Blocker Stokes Mothers Act, as a part of the Affordable Care Act to increase research on postpartum depression and make treatment options more accessible. And yet today, Madam Chairman, 60% of pregnancy-related deaths are deemed preventable. African American women are dying at 3 to 4 times the rate of white women. Despite the amount of money spent on health care, America's maternity mortality rate remains the highest in the developed world, which is a true national embarrassment. That is why I am pleased that we are considering legislation today which builds upon the Melanie Blocker Stokes Mothers Act to reduce the rates of maternal mortality. I also want to commend my colleague from Illinois, Ms. Kelly, for her leadership on these and other important matters and for sponsoring this bill. The bills up for consideration today fight implicit and explicit bias which puts African American mothers at risk, study the potential role of dualists, and expand postpartum care to a full year across the nation. Additionally, I'm proud to co-sponsor the Reversing the Youth Tobacco Epidemic Act. This bill will take important steps to reverse the damage done by unregulated vaping products, which are currently used by 1 in 4 high school students. It will also ban menthol products, which are primarily used because of the decades of predatory practices by tobacco companies on the African American community. Menthol products lead to worse health outcomes and premature death. And I'm proud that I am pleased that this legislation that we're considering today, while protecting the public by explicitly stating that there is no criminal liability for consumers. In short, Madam Chair, the bills we're considering today will save lives, and I look forward to voting for them, and I yield back the balance of my time.
Gentleman yields back. Are there any other members that wish to make an opening statement? Seeing or hearing none? That concludes our opening statements. Members, you know that pursuant to our committee rules, that your written opening statements will be made part of the record, and you can submit those opening statements to the clerk's desk. So at this time, we're going to begin consideration of the bill. The chair calls up H.R. 2339, the reversing of the Youth Tobacco Epidemic Act of 2019, and the clerk will report the title of the bill.
H.R. 2339, a bill to amend the Federal Food, Drug, and Cosmetic Act with respect to the sale and marketing of tobacco products and for other purposes.
Without objection, the first reading of the bill will be dispensed with, and the bill is now considered as read. And it is open for amendment at any time. Yep. Yeah. The chair is going to recognize herself to strike the last word on the underlying bill before we go to amendments. Obviously, I'm proud to support 2339, Reversing Youth Tobacco Epidemic Act. The title of the bill really says it. It says youth, and it says epidemic, and it says tobacco, and it says that we want to reverse the trends that we know are at hand. We heard during our highly instructive hearing that there really is a crisis amongst young people in our country on this issue. For the first time in decades, the CDC now reports that youth tobacco use is rising, and it's because of e-cigarettes. We learned that in 2018, 4.9 million middle and high school students were current users of some type of tobacco product or e-cigarette. And many of these young people will become lifelong smokers. Over 90% of adult smokers began smoking before they turned 21. So that's a big hook, and it's a long-lasting one. In our hearing, we learned that any legislation to address the crisis needed to be multi-pronged. It's not just enough to raise the legal age to purchase tobacco products. The legislation extends tobacco marketing, sale, flavor restrictions, and fees to e-cigarettes, and it also makes the landmark change of raising the minimum age to buy tobacco products to 21 years. And we know that by raising the age to 21 will result in 250,000 fewer premature deaths. That takes my breath away. I don't know about all of you, but that's quite a statement that this legislation can achieve that. And it's for those born between 2000 and 2019. I think what makes this legislation really very important is that it's comprehensive. A ban on flavors is an integral part of any bill to reverse the youth e-cigarette use and drive down tobacco use overall. And at our hearing, we heard from expert witnesses that the e-cigarette industry targets flavors. We heard Dr. Ruiz talk about this young person that he visited in the hospital, his constituent, and advertising with the intent of attracting and addicting generations of young people. We learned that the single most important action to reduce the cigarette use of young people would be to crack down on flavors. The Trump administration has made promising progress by considering a ban on all e-cigarette flavors, but is now considering excluding menthol and mint from that ban, which I think is taking a step backward. But nonetheless, I believe that it's critical that all flavors be prohibited so we can address the true breadth of the crisis. In order to solve it, we have to have strong legislation that takes all the necessary steps. I believe that this bill does, and I'm proud to support it, and I urge my colleagues to support it as well. At this point, what? Is there anyone else that would like to speak on the underlying bill? Republican side. Mr. Shimkus?
Madam Chairman.
Yeah, the gentleman from Illinois is recognized.
Just a point to be made. If you're on a forward operating base in the mountains between Afghanistan and Pakistan, and you're a young private, 18 years old, I seriously doubt that the senior non-commissioned officer would tell that young private that who's putting his life on the line, who's got more things to worry about than smoking, that cigarette smoking for a young infantry private in a forward operating base is illegal. And I think we need to address those issues of those in the military who we are asking to put their lives on the line. We're considering them adult because they're carrying a weapon, but we're not going to let them to smoke a cigarette. So I just want to put that point on record.
Beck? Is there any member on this side of the aisle that would like to make a statement on the underlying bill? Mr. Hudson is recognized, the gentleman from North Carolina.
Madam Chairman, thank you. I move to strike the last word. I thank the Chairman and appreciate your commitment to combating youth initiation and use of vapor products. Combating this epidemic is a priority of mine. Indeed, I'm sure it's a priority of everyone on this committee. As I stated at the hearing we held on this legislation last month, this legislation has potentially serious unintended consequences. The issue that Mr. Shimkus just raised, I want to agree with. It's the impact of members of our military. This legislation proposes to raise the legal age to purchase tobacco products to 21 years of age. I represent Fort Bragg, the largest military installation in the world. I can't justifiably tell our soldiers that are old enough to fight and die for our country, but they can't purchase a legal tobacco product. I would ask, Madam Chairman, that we incorporate a carve-out for members of our military. Looking at the larger mechanics of this legislation, though, I fear the way this legislation treats traditional tobacco products is misguided. As I stated last month, menthol cigarettes have seen declining utilization rates over the last 20 years for both adults and youth. Further, this committee has seen letters from law enforcement that expresses real concerns that adult tobacco users would be forced to go to the black market to find menthol cigarettes. On that very issue, I have bipartisan legislation with Representative Sheila Jackson Lee aimed at combating the sale of illicit tobacco products worldwide because counterfeit and illegal tobacco products fund criminal syndicates and terrorist organizations. What makes this ban even more puzzling is the FDA released us statistics last month saying that even in vapor, the very product category we're seeing growing utilization rates, menthol is among the least popular flavors. Additionally, this legislation bans flavored products in the smokeless category. The smokeless category has very low utilization rates with youth and adults. So I can see no policy reason to ban a product that does not have a growing utilization rate. So I'm asking the committee, why do we need to ban legitimate products used by adults when our goal is to stop youth initiation of products in a completely different category? Legitimate and laudable intentions do not always make best policy. And I hear the real commitment from my colleagues on both sides of the aisle when we talk about this issue. There's a lot of passion today. But let's focus on the real problem at hand. We could easily reach a bipartisan solution that has a chance of actually becoming law. But instead, we're spending our time debating legislation that is, in my opinion, a gross overreach and that will drive consumers to illegitimate sources for legitimate legal products. I hold out hope, Madam Chairman, that we can work together to find a data-driven solution that will accomplish our shared goal of ending this youth epidemic responsibly, and I stand ready to work with you on that. And with that, Madam Chairman, I'll yield back.
The gentleman yields back. Mr. Engel? The gentleman from New York, did you want to be recognized?
Move to strike the last word, Madam Chair.
So ordered. You're going to yield?
I yield back to you, Madam Chair.
I appreciate the gentleman yielding to me. This is a very important topic that's being raised, the nexus between the military and tobacco. Tobacco use is particularly high in the military. And close to half of all military service members reported using a nicotine product in the past year. Now, the military recognizes the negative impact of tobacco on troop readiness and health and has taken active steps to reduce tobacco use through a variety of DoD-wide and branch-specific policies aimed at improving and sustaining military readiness, health, fitness, and quality of life. Even Senator McConnell agrees that the military should not be, quote, treated differently on a public health issue. Today, the DoD and the Army, Navy, Marines, and Air Force have all set goals to become tobacco-free. Military leaders support efforts to reduce tobacco use in the military and not exempt them. General Robert Magnus, Assistant Commandant of the Marine Corps, has said, quote, tobacco impairs reaction time and judgment. It stands in the way of a Marine's #1 priority, to be in top physical and mental shape, combat ready, unquote. Rodney McKinley, Chief Master Sergeant of the Air Force, has stated publicly that, quote, tobacco use impacts physical fitness, night vision, and healing. It impairs mission readiness, unquote. And I already quoted Senator McConnell. So I think it's very important to place these things on the record. We're talking about public health and all the impacts that tobacco use has on human beings, whether they're in uniform or not. And I think that what the leadership in the military have said is very important to be part of our record and what's being raised. So, the DoD currently spends more than $1.6 billion, with a B, dollars each year on tobacco-related medical care, increased hospitalization, and lost days of work. So, as always, the taxpayer picks up the tab, and we want the VA to be funded in a robust way, but make no mistake about it. This adds to the costs that need to be covered by the taxpayer in the VA because of the effects of tobacco on our veterans, on our troops. It is as they said, a readiness issue. So I appreciate the gentleman yielding time to me. And does the gentleman want to reclaim his time? Mr. Engel, do you want to reclaim your time?
No, I yield back my time.
Okay, gentleman yields back.
Madam Chairwoman?
Yes, Mr. Bouchon, you're recognized.
I move to strike the last word. I'm normally not for the government putting in more regulations, but on the other hand, as a doctor, looking at the data, it's pretty clear we need to do something about the epidemic in grade schools and high schools, and that is e-cigarette use. As a cardiothoracic surgeon and a father of 4 kids, I'm deeply troubled by the increasing rate of e-cigarette use amongst our children. The long-term negative health implications of nicotine use on the heart and lungs are well known, And by offering enticing flavors, these vaping companies are attracting teens and preteens, actually, who might not otherwise have exposure to nicotine. The fact is, high school and middle school students are getting their hands on these products, setting them up for a lifetime of nicotine addiction and negative health side effects. In 2018, more than 3.6 million U.S. youth, including 1 in 5 high school students and 1 in 20 middle school students, reported to have used e-cigarettes. The focus of this issue must be on the health of our children. It is important not to lose sight of this by using the epidemic to impose excessive and overreaching government regulation that would affect law-abiding adults. Let's all continue to keep our eye on the ball of the real issue here today. That said, I continue to be a long-term advocate for adults to avoid the use of nicotine-containing products. Again, the crisis is e-cigarette use in grade schools and high schools, and I hope we can work together to end the epidemic. I yield back.
Gentleman yields back. Is there anyone else that would like to speak to the underlying bill? Seeing or hearing none, I recognize Mr. Pallone to offer an amendment in the nature of a substitute.
Thank you, Madam Chair, and I have an amendment at the desk. It's the amendment in the nature of a substitute for H.R. 2339.
Clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 2339, offered by Mr. Pallone. Strike all after the enacting clause and insert the following.
Without objection, the reading of the amendment will be dispensed with, and Mr. Pallone, you're now recognized for 5 minutes.
Thank you, Madam Chair. This amendment in the nature of a substitute makes technical and conforming changes based on technical assistance and feedback from the FDA, as well as changes intended to address feedback I've received from committee members and other stakeholders. For example, these changes include updating certain timeframes, such as the issuance deadline for a final rule concerning graphic health warning labels, a deadline that has changed since I introduced the bill in April. This August, FDA moved forward with a proposed rule to update cigarette graphic health warnings pursuant to a court order, so this amendment makes clear that the final rule should be on the same schedule as mandated by the court. The amendment also clarifies the flavor prohibition for tobacco products to better align the exceptions for this prohibition for electronic nicotine delivery systems with the pre-market review process that FDA already undertakes before issuing a marketing order. Specifically, the amendment states that 30 days after enactment, no electronic nicotine delivery system shall contain a flavor unless FDA reviews the product and determines that it meets three criteria. First, the product significantly increases the likelihood of smoking cessation amongst current users. Second, the product will not increase the likelihood that individuals will start using any tobacco product. And third, the product is not more harmful than a product without a characterizing flavor. And what we want, Madam Chair, is for current smokers to have the tools they need to quit, and some strongly believe that certain flavored e-cigarette products have helped them do that. But we also have to be careful by balancing this trade-off with the very significant public health concern that these products are appealing to kids on unprecedented rates. It's one of the things that Chairwoman Eshoo stressed. Now, my legislation balances these interests to ensure that FDA has the tools it needs to better protect our young people from a lifetime of nicotine addiction and to ensure that these products are coming into regulatory compliance. The amendment also makes changes to the bill's provision that increases FDA's total tobacco user fees and extends these fees to all classes of tobacco products. This was a Trump administration budget proposal that I believe will help the agency to better oversee the proliferation of e-cigarettes, and I plan to continue to improve upon that language in coordination with the FDA as we move forward. The amendment also includes a new section based on input from Representative Engel that instructs the Secretary to update public awareness campaigns to target young people ages 18 to 21, given that this legislation increases the minimum age to purchase tobacco products to 21 as well. Now, I also heard from some colleagues concerns that prohibiting certain flavored tobacco products like menthol cigarettes would unintentionally result in disproportionate and greater targeting of African Americans by law enforcement. And I want to make clear that the intent of this legislation is to prohibit the manufacture of flavored tobacco products, and FDA's enforcement of this provision should rest with the industry that makes and sells these products, the manufacturers. I don't support, and I stress, I do not support any policing tactics that would unnecessarily stop, search, or investigate individuals who might be in possession of these products, and that is certainly not the intent of the legislation. Instead, the bill is intended to eliminate these products from the stream of commerce in order to improve public health, prevent early death and disease, and stop kids from getting hooked on tobacco in all communities. But to drive this point home, the amendment includes specific language to reiterate that no individual who purchases or possesses for consumption a tobacco product that contains a prohibited flavor will be subject to criminal penalties for that possession. And finally, we have been waiting for weeks now for the Trump administration to follow through on President Trump's promise in September to clear the market of flavored e-cigarettes. And I'm concerned by the delay. Just this past Friday, one of the White House's top domestic policy advisors questioned why FDA regulates tobacco products at all. And over the weekend, the president said he will be meeting with the very industry players that are responsible for the current epidemic to help craft policy moving forward. And I just find this unacceptable. It's all the more reason why we have to move forward with this legislation. I'm committed to continuing to work with the FDA and others to perfect this bill between subcommittee and full committee market as needed. But I do believe that H.R. 2339 is a strong and comprehensive bill that will help address the youth tobacco epidemic that is gripping our nation. I appreciate the many members of the committee who expressed support for the bill. It is bipartisan in the sense that some Republicans do support it, and I urge my colleagues to support this amendment in the nature of a substitute and the underlying legislation. I yield back, Madam Chair.
The gentleman yields back. Are there other members seeking recognition to speak on the amendment? Mr. Bouchon is recognized.
Thank you, Madam Chairwoman. A couple questions for you. You would agree that flavors like cotton candy and gummy bear are targeted towards children, correct?
Yes.
Yeah, or Mr. Chairman. And isn't it true that illegal THC vape products on the market right now advertise they can be purchased in these kid-friendly flavors?
Yes.
Yes. Given that the illegal products are being marketed with kid-friendly flavors, I think it's important that any legislation being considered address THC vape products, especially given that the outbreak in vaping-related illnesses that have been linked to these products and now to vitamin E. So I have a question for council. Does the definition of an electronic nicotine delivery system as created by this bill include electronic devices that deliver THC or other marijuana derivatives through an aerosolized solution?
Congressman, the bill defines electronic nicotine delivery systems on page 10 of the legislation, and defines it as a product that delivers nicotine, flavor, or another substance via an aerolized solution to the user inhaling from the device.
Okay, so it doesn't. So the answer is no. It doesn't specifically address that. So the bill doesn't do anything to address illegal THC flavored vape products, despite the most recent evidence presented by the CDC that most of the vaping-related illnesses, even the ones with vitamin E, have been caused by these types of products. Madam Chairwoman, Chairman Pallone himself stated his concern over recent reported vaping-associated lung injuries in a letter to the administration last month, but the CDC has stated the findings suggest THC is present in most of the samples tested to date, and we did have an update yesterday. I find it troubling that the bill does not do anything to address concerns surrounding illegal THC products and the vaping-related illnesses being caused by these products. To clarify again, the bill would prohibit the marketing of flavored THC and marijuana derivative products if they meet the definition of an ENDS product under the bill?
Again, the definition of an ENDS product is defined on page 10 and 11 of the legislation to mean an electronic device that delivers nicotine, flavor, or another substance via an aerolized solution. It does not mention tobacco products, although Chapter 9 of
THC products.
THC products, Chapter 9 of the Federal Food, Drug, and Cosmetic Act is limited to tobacco products that contain tobacco.
Okay. Madam Chairwoman, I appreciate that you're that we're looking into the illegal products as well. And I think more should be done to prevent the marketing of these products, since it's clear that even with the evidence related to vitamin E, that most, if not all, of the vaping-related illnesses have been also temporarily related to illegal THC vaping products. Thank you, and I yield.
The gentleman yield to me?
I will yield, yes, sir.
You know, I don't disagree with you. I don't think. I mean, look, I have to be honest with you. My concern, and I'm sure many of the concerns of the members of this committee on the issue of vaping and cigarettes, you know, dates to well before the latest crisis. I mean, I remember, you know, 5 or 6 years ago, I went around to a lot of the middle schools or junior high schools in my district and was shocked to find out at some of the assemblies that the kids thought that vaping was totally harmless, that, you know, e-cigarettes contain no nicotine, it didn't cause any problems. And that's because of the marketing of this stuff to the kids. So what I guess I'm trying to say is, you know, the FDA has a lot of authority. And I've been very critical of the FDA that they haven't moved on the things that we have in this legislation. And when the president came out and said he was going to move on some of them, I was very happy. But now it does seem like he may be backtracking. So the THC issue is out there. I'm not suggesting it isn't, and I'm not suggesting we're addressing it here. But I don't think that that we should wait. I don't mean to suggest you're saying that either, but I don't think we should wait until we finally find out what's going on with THC and cannabis and the rest of this. I think that we need to take the opportunity now, particularly with the president, you know, saying that he wants to, in theory at least, do all this to pass the legislation. And as you know, even Mitch McConnell has said he wants to raise the age to 21. So,
I'm going to reclaim the last 15
Sure.
seconds just to thank you for that. I still think the committee needs to address the THC vaping issue. Thank you very much. I yield
The
back.
gentleman yield his 3 seconds to me?
Yes.
I agree with you. I don't think that this bill was put together before the CDC came out with their report.
Okay,
But I
fair
agree
enough.
with the gentleman.
Thank you.
I mean, this is, when the CDC says that this sticky stuff that clings to lungs kills people, we need to do something. So I want to work with the gentleman on this. I think that there would be bipartisan support on the effort, and I look forward to working with you to address it.
I yield back.
Thank you. Gentleman yields back. Is there anyone else? Let's see. Mr. Engel, the gentleman from New York, is recognized.
Thank you. Thank you, Madam Chair. I move to cite the last word. Thank you, Chairman Pallone, for working with me to ensure that tobacco prevention programs include young adults. As with middle and high school students, more college students are vaping nicotine than ever before. The University of Michigan's Monitoring the Future survey, which is supported by the National Institutes of Health, found that in 2018, 16% of college students vaped nicotine in the past 30 days, up from only 6% the year before. I'm pleased to author Section 106 of this amendment, which will direct the FDA to revise existing tobacco education programs, such as the Real Cost Campaign, to include prevention materials for young adults aged 18 to 21. Section 106, coupled with the other provisions of Chairman Pallone's bill, such as raising the national tobacco purchasing to 21 years of age, will help pave the way for the first generation of tobacco-free Americans. Thank you, Madam Chair, and I yield back the balance of my time.
Gentleman yields back. Is there anyone else that would like to? Yes, the ranking member of the subcommittee, Dr. Burgess, is recognized.
Thank you. And actually, I have a question for council, if I could. So is it true that under Section 106A of the Tobacco Control Act that the Food and Drug Administration is statutorily mandated to provide Congress with biennial reports on the progress and implementation of this act?
That is true, Congressman.
So we've only been able to track down the 2012 copy of the report that was required to be submitted 3 years after enactment, but no subsequent reports have been posted. So question for either council or the chairman of the committee, have you received copies from the FDA of the reports required for 2014, 2016, or 2018?
Congressman, I'm not sure. We can check in and get back to you, but to my knowledge, at this time, no.
Well, in fact, staff was told by FDA that they were unable to provide reports for the years after 2012. So now we're considering allowing the agency to collect more fees when the Center for Tobacco Products has basically been vacuuming up user fee dollars and ignored congressional mandates. So we should conduct proper oversight into the Center for Tobacco Products and determine what their previous expenses have been and what the financial need is before increasing their authority to collect additional money. And I do have two amendments related to this. So, Madam Chair, may I call up my first amendment at the desk?
I think, wait a minute, let's see. Is there anyone else that, any members from either side that wish to make a statement about the Ains?
Madam Chair,
Yes, the gentleman from New Mexico.
strike the last word. Madam Chair, I just wanted to ask for unanimous consent to submit into the record an article, January 25th, 2019, from Vox. I'll supply the article to the committee. The title is "The Vape Company Juul Says It Doesn't Target Teens. Its Early Ad Tells a Different Story." The analysis was conducted by a Stanford research group into the impact of tobacco advertising, and have shared their study of the company's marketing campaign between Juul's launch in 2015 and the fall of 2018. They also looked at thousands of Instagram posts, emails, and ads, and came to the searing conclusion Juul's marketing was patently youth-oriented. And it talks about how the crisis that was created was targeting towards youth with flavors, with aggressive campaigns, with their social media outreach, including those contracts that they were securing with schools to tell the kids directly that this was a safe product to get them off of smoking cigarettes. So I'd ask unanimous consent to submit this article into the record.
So ordered. Is there anyone else, either side, that would like to speak to the Ains? The gentleman from Texas, Mr. Burgess.
Thank you, Madam Chair.
Recognized.
I have an amendment to the Ains at the desk. That. Let's see, where are we?
What is your amendment labeled?
Yeah, I would like to call up amendment R06.XML.
Do you have the amendment?
Yes, ma'am.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2339 offered by Mr. Burgess. In Section 104, strike subsection A.
Without objection, the
related.
reading of the amendment will be dispensed with. The gentleman is recognized for 5 minutes to speak to his amendment.
Thank you. And this amendment will strike the increase in user fees from $712 million to $812 million proposed in the amendment to the nature of a substitute to H.R. 2339. This amendment additionally requires that the Food and Drug Administration provide an answer within 30 days to the Committee of Jurisdiction as to why they have not complied with Section 106A of the Tobacco Control Act, which requires biannual reports to Congress on the implementation progress of the Tobacco Control Act. The Food and Drug Administration submitted a report in 2012, but no reports for 2014, 2016, and 2018. In fact, Congressman Eshoo and I recently sent a letter to the FDA questioning the use of tobacco user fees. The FDA has collected nearly $712 million in tobacco user fees in 2019, the use of which is largely unclear. I believe we should not increase the tobacco user fees by $1 million without full understanding of what the use of these fees are. So thank you for considering the amendment. I have the letter that we sent. If you need to be refreshed on that, and I might ask unanimous consent that we submit this for the record.
So ordered. I remember the letter very well.
And I urge adoption of my amendment to the amendment in the nature of a substitute and yield back my time.
So what again does your amendment do?
It strikes the user fee,
Oh, it strikes the user fee. Okay.
the increase from 712 to 812 proposed in,
Did you yield back?
yes.
Okay.
Madam Chair,
Uh-huh.
I could recognize an opposition.
Are recognized?
I move to strike the last word and speak in opposition to the amendment by Ranking Member Burgess to strike the increase in user fees for tobacco products. Now, this provision of my legislation with regard to the user fees is based on a fiscal year 2020 Trump administration budget proposal to increase the fees collected under the Tobacco Control Act by $100 million. Many people on this committee know I don't usually agree with the Trump administration, but this is an exception. As explained by the Trump administration's budget request, this increase was intended to ensure FDA could extend user fee assessments to include manufacturers and importers of all deemed products among the tobacco product classes in order for the Center for Tobacco Products at FDA to continue implementing the FDA-wide Comprehensive Plan for Tobacco and Nicotine Regulation. As members of this committee know well, the Center for Tobacco Products at FDA is completely user fee operated and does not receive any appropriated dollars from Congress. So this means that all activities performed by CTP in order to provide regulatory oversight of tobacco must come from the assessment of user fees. It's critical that FDA have access to the resources it needs to protect the public health, enhance enforcement activities against bad actors, and review the products that are coming to market and are contributing to the youth tobacco epidemic. In the 2020 Trump administration budget proposal, the administration explained in significant detail why an increase in user fees was necessary. The justification outlines in detail the Tobacco Control Act program's performance measures for the most recent fiscal year on record and the next fiscal year targets, and I would like to request unanimous consent to enter into the record the fiscal year 2020 FDA budget justification. I don't have it, though, but I'd like to ask unanimous consent.
So ordered.
Thank you. I think we should all agree that it no longer makes sense for e-cigarette manufacturers to be exempt from paying user fees when these products are taking up a larger market share of tobacco products than ever before. But for this to be effectively implemented, we also should be raising the fees overall to ensure FDA is equipped to assess these fees to these manufacturers. And again, I don't usually agree with the Trump administration, but in this case I do. And for this reason, I urge my colleagues to oppose this amendment.
Gentleman yield?
Yes, I yield.
I recall very well, because it was, first of all, it was very recent that the ranking member and myself sent a letter to the acting commissioner of the FDA relative to this issue. And the user fees that are collected, we questioned, especially the amount for 2019. It's a very large amount of money. What exactly is being done with that? But user fees fund this entire operation. So to cut them off, as we are essentially complaining about the slowness of the FDA and other issues related to what's being taken up today in this legislation, I think we're cutting off our nose in spite of our face. I agree with the gentleman wholeheartedly that they need to answer our questions, and we ask them appropriate, tough questions. But we're not going to get very far with implementation relative to chasing down and making sure that we don't have another national epidemic on our hands and leave zero in the account. So I appreciate the gentleman yielding. I yield back.
Would the gentleman yield?
Sure. Yeah.
And I just, again, want to point out that a law passed by Congress 10 years ago that originated in this committee when Henry Waxman was chairman, that required the Food and Drug Administration to report back to us on the collection and the use of the user fees, and they haven't done so since 2012. So this amendment to the amendment, the nature of a substitute, would require that report. I don't know what other mechanism we have to get the agency to comply
Would
with
the
the law
gentleman-
that was
yeah.
passed
Would
in
the gentleman yield?
2009.
Would the
Yes, I
gentleman
yield
yield? But it's my understanding that you're cutting off the user fees.
back.
I'm
Cutting
all
off-
for getting the reports from the FDA.
Cutting
I'm-
off
I'm
the-
fu- I'm furious that the FDA hasn't moved according to the law, that every 2 years they submit a report. Now, maybe it's lost somewhere back in the stacks of paper, but no one seems to recognize that anything has arrived for, for 3 seasons. But I don't want to cut off user fees. I'm not for that.
I think I had the time, so I yield back.
Okay. The gentleman yields back.
Gentleman from-
What? You had 7 seconds?
gentleman from
Oh, you went over. Okay.
Gentleman from Montana.
All right. The gentleman from Montana, Mr. Gianforte, is recognized.
Yeah, just a question for Dr. Burgess. My understanding of your amendment is that it doesn't cut off the user fees, it just cuts off the increase, the additional money we're giving to them. The $700 million stays in place. The amendment just deals with the increase. Let's not give them a raise because they haven't done their job. Is that correct?
An increase of $100 million when they haven't done their job in the first place, but the underlying user fee continues to be collected. And we'd still like to know how much they're collecting and what has happened with it. So I thank the gentleman for that clarification.
Gentleman yield?
Certainly.
It's my understanding that the FDA does not have the authority today relative to e-cigarettes. So what we're taking up in the underlying legislation advances what we all know needs to be advanced. So I would question I think maybe the usefulness of this amendment at this time. I think there are steps that we can take immediately with the FDA to get these reports because they're, I don't know what the reason is. There can't be one that's good enough. We've got another acting commissioner here, so maybe he can find them. I don't even know if they've been drawn up, but Congress should be reported to according to the law. But if members think that this amendment is going to advance the issue that we are discussing and all care about this morning relative to e-cigarettes, the authority is being granted in this legislation. It's not already there.
Madam Chair, reclaiming my
I thank
time.
you.
Just
I thank you for
just
yielding.
to put a sharp point on it, the user fees, as I understand it, over $700 million going to them. The gentleman's amendment simply says no increase until they do what they promised to do. And
In
I
the
would yield to
intelligence
the gentleman if he
community,
has
we
any
call that
additional comments.
fencing money.
I thank the gentleman for, and this is correct. This is an effort to get the agency to comply with the existing law. We pass new law for new authority. What guarantee do we have that we will know that that money will be used for the purpose for which you intended? And that is inherently the difficulty if we allow this process to continue with the FDA not complying with the law as it was passed in 2009.
Would the gentleman
And I
yield?
back to the gentleman from
The gentleman
Montana.
yield?
Yes.
Just very quickly, in our letter, Dr. Burgess, we asked the agency to respond to us no later than November 21st. I think we should give them the time to do that. And
Madam Chair,
yield
just
back.
reclaiming, have we received the reports that were due under the existing statute?
we haven't.
Just if the gentleman would yield, we did receive the report for 2012, but not for 2014, 2016, 2018, as required under the law.
Okay, and I support the gentleman's amendment because this is just a common sense tool to, let's not give somebody a raise if they haven't done their job, and that's what we have going on here. So with that, I yield back.
Gentleman yields back. Let's see who's next. Is there anyone on the Democratic side that wishes to speak to the amendment? No? Hearing none? Anyone else on the Republican side? No? All right. There's no further debate. We'll proceed to a vote on the amendment. All those in favor of the amendment will signify by saying aye.
Aye.
All those opposed will signify by saying no. No?
I will ask for a recorded vote.
All right, the gentleman has requested a recorded vote. Recorded vote is ordered. Those in favor of the amendment, well, we already did that, so a recorded vote is in order, and the clerk should call the roll.
Mr. Engel? Mr. Engel votes no. Mr. Butterfield? Mr. Butterfield, no. Ms. Matsui? Ms. Castor? Ms. Castor votes no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Lujan? Mr. Lujan, no. Mr. Schrader? Mr. Kennedy? Mr. Kennedy votes no. Mr. Cardenas? Mr. Welch? Mr. Ruiz? Mr. Ruiz votes no. Mrs. Dingle? Mrs. Dingle votes no. Ms. Custer? Ms. Custer votes no. Ms. Kelly? Ms. Kelly votes no. Ms. Berrigan? Ms. Berrigan votes no. Ms. Blunt Rochester? Ms. Blunt Rochester, no. Mr. Rush? Mr. Rush votes no. Mr. Pallone? Mr. Pallone votes no. Mr. Burgess?
Aye.
Mr. Burgess, aye. Mr. Upton? Mr. Upton, aye. Mr. Shimkus? Mr. Guthrie? Mr. Guthrie, aye. Mr. Griffith? Mr. Griffith, aye. Mr. Bilirakis? Mr. Bilirakis, aye. Mr. Long? Mr. Bouchon? Mr. Bouchon votes aye. Mrs. Brooks? Mrs. Brooks, aye. Mr. Mullen? Mr. Mullen, aye. Mr. Hudson? Mr. Hudson votes aye. Mr. Carter? Mr. Carter votes aye. Mr. Giaforte? Mr. Giaforte votes aye. Mr. Walden? Mr. Walden votes aye. Ms. Eshu?
No.
Ms. Eshu votes no.
Have all members responded to the call of the roll?
Mr. Cardenas is not recorded. Votes no. Mr. Schrader votes no.
Matsui? No. Does any member wish to change his or her vote? If not, the clerk will report the tally.
Madam Chairman, on that vote, the yeas were 12 and the nays were 17.
All right, the vote is 12 ayes and 17 noes. The amendment is not agreed to. Are there further amendments to the amendment in the nature of a substitute? Chair recognizes, what? Oh, I'm sorry. You'll be after him, all right. Mr. Butterfield is recognized.
Thank you, Madam Chair. I have an amendment at the desk. It may be labeled as number 2. It has a long number, and I don't know how to refer to it. It's the Butterfield Amendment.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute H.R. 2339 offered by Mr. Butterfield. At the end of the bill, add the following Title III, Public Health Program.
Without objection, the reading of the amendment will be dispensed with. The gentleman is recognized for 5 minutes.
Thank you, Madam Chair. Madam Chair, much of the bill before us today focuses on prevention, and that's a good thing. That's a very good thing. My amendment focuses on cessation promotion for individuals who are currently using tobacco products who would simply like to quit, particularly in low-income communities. My amendment directs the Secretary to ensure that programs at the CDC related to outreach to medically underserved communities include efforts to prevent tobacco use and promote smoking cessation. It also directs the Secretary to create a new demonstration grant program authorized at $3 million annually for public health departments to support development of improved evidence-based smoking cessation strategies, improved communication and outreach tools, and improved coordination, access, and referrals for smoking cessation in underserved communities with a focus on racial and ethnic minority populations. Now, Madam Chair, it's no surprise to anyone on this side of the committee, at least, that I do have reservations about the impact of the ban on menthol flavors for traditional tobacco products. Congress's legislative interest should be cessation, smoking cessation. You know, yesterday, Madam Chair, I went over to the Capitol for my annual physical, and during the examination, I was told that since I had smoked from age 16 to age 36, and that I'm a male, that I needed to have an ultrasound of my stomach. I could not understand the relationship between a male who smoked 30 years ago and possibly injury to the stomach. And so the point was that it's nicotine. Nicotine is the problem. It is unfair and cynical to think that we can curb cigarette smoking by imposing a ban on menthol. Among cigarette users, 2/3 prefer non-menthol cigarettes, 1/3 prefer menthol cigarettes. It's a 2/3, 1/3 relationship. If you want to address the dangers of smoking, why do you target only those who smoke menthol? I suggest that if a ban is put in place on menthol cigarette use, you know what's going to happen? Aside from constituents getting angry, they will simply choose another smoking preference, the non-menthol cigarette. A ban on menthol will not lead to smoking cessation, period. It's interesting to note that among African Americans who choose to smoke, 80%, 8 out of 10, 80% African Americans prefer menthol as opposed to non-menthol. That's their cigarette of preference. I will close by using one simple example. Suppose we wanted to ban wine consumption and passed a ban on Cabernet wines as opposed to Merlot wines. Merlot consumers would be relieved that they were not targeted, but Cabernet consumers would feel targeted. That's why many in the African American community will feel targeted by a ban on cigarette menthol, while other consumers are untouched. Mr. Chairman, Madam Chair, if the goal of this legislation is to lead to cessation, let's get serious and develop a sensible plan that will lead to total smoking cessation, if that is your goal. But let's not target those who use menthol and leave those who use non-menthol products alone. Thank you.
The gentleman yield?
Yes, I will yield.
I just wanted to express my support for the amendment. Reversing the tobacco epidemic means we have to stop people from becoming addicted to smoking and e-cigarettes, but it also means we have to be there for those who currently smoke and need assistance in quitting. And Mr. Butterfield's amendment provides grants to public health departments to develop evidence-based smoking cessation strategies for medically underserved communities. It also has communications tools to ensure people understand and have access to these strategies and improve coordination and referrals. So his amendment will improve access to care and will improve health outcomes. And so I encourage my colleagues to support the amendment. I yield back to the
Thank you, Mr. Pallone. Thank you very much. And I will simply close by saying that the problem is nicotine. It's not menthol. Thank you. I yield back.
Are there any other members that wish to speak on the amendment?
Madam Chair, move to strike the last word.
The gentleman from Oregon is recognized.
I want to thank my friend from North Carolina for offering what I think is really a thoughtful amendment. We appreciate it. This amendment ensures the CDC conducts outreach to medically underserved communities on efforts to prevent tobacco, e-cigarette, and nicotine addiction, along with providing education on smoking and e-cigarette cessation. The amendment also authorizes a demonstration grant program to develop strategies for smoking and e-cigarette cessation in underserved communities, particularly those with racial and ethnic minority populations, and all that's really important. H.R. 2339 is primarily focused on prevention or blocking the on-ramp to nicotine addiction. However, it's also critical we consider strategies that provide an off-ramp to those currently using tobacco and e-cigarettes. That's why this amendment is important. It directs public health resources and outreach toward nicotine cessation. And I support the amendment, but I would like to work together on getting some technical, just strictly technical feedback from the CDC to make sure we get it right. So I would ask the gentleman to either consider withdrawing the amendment or committing to work with us to make sure we can get the language right before the full committee markup. And I would yield to my friend from North Carolina.
Words, and you and I work together on other pieces of legislation, and we will certainly work together on this, and I will commit to you that I will work with you.
I appreciate that.
Thank you.
With that, I yield.
If there is no further debate, we'll proceed to a vote on the amendment. All those in favor of the amendment will signify by saying aye. Aye. All those opposed? In the opinion of the chair, the ayes have it. The amendment is agreed to. Are there further amendments to the amendment in the nature of a substitute?
Madam Chair?
Yes.
I have an amendment at the desk. It is a whole bunch of numbers, but basically 05.
What is your amendment
R05.
labeled? 05?
R_05.xml.
The clerk will report the amendment, please.
Amendment in the nature of a substitute, an amendment to the amendment in the nature of a substitute to H.R. 2339 offered by Mr. Walden. Page 10 after line 12, insert the
Without
following.
objection, the reading of the amendment will be dispensed with. The gentleman is recognized for 5 minutes to speak to his amendment.
Well, thank you very much, Madam Chair. The legislation we're considering today proposes a new standard for marketing flavored vapor products. And while I think most of us agree that certain flavors can be attractive to children and should under no circumstances be marketed or sold to minors, there is not sufficient evidence to prove that the flavors themselves make these products inherently more dangerous. There's no reason to subject flavored products to a different marketing standard than all other tobacco products. The current standard is appropriate for the protection of public health, which I believe is a high standard to meet, and justifiably so, and that standard should apply to electronic nicotine device products as well. Now, this bill requires that flavored electronic nicotine device systems, or ENDS, be less harmful to users than ENDS products that are not flavored in order to be marketed. So we've discussed at length in this committee concerns that banning these products may drive consumers to the illicit market. This amendment will require that the Secretary consider whether the denial of an application for a flavored ENDS product will increase the likelihood that consumers will turn to purchase illegal and adulterated products on the licit market when determining whether a flavored product is not more harmful than an unflavored ENDS product, if you understand all that. So, if this additional standard must be met in order to market a flavored ENDS product, I believe when determining relative harm, it's important the Secretary consider that consumers may seek out more dangerous unregulated products if regulated flavored products are unavailable. And as you know, Madam Chair, in the Oversight and Investigation Subcommittee in September, we held a hearing on vaping-related illnesses. And what we learned then, and what has been subsequently confirmed, is it's the illicit products purchased on the illicit market that are responsible for some of these really, really terrible illnesses and deaths. The underlying bill does nothing to address the rise in these illnesses and arguably will exacerbate the problem if more people shift to buying unregulated, illicit market products. So I hope my colleagues will support this amendment. I recently held a roundtable on the work we did on opioids down in the southern part of my district, and one of the doctors there that treats people with addiction was walking through one of the towns in my district one evening. It was their first Friday event, and he said he walked by this store and they had a sign out that said, "Get your oils here for vaping, your essential oils for vaping. He said, oh my God, what are we doing? They're selling these oils. This is the market we need to be going after, where innocent people are being marketed products that they put in their own devices and go forth, and they're literally killing themselves and their friends as a result. I've got deep and serious issues about THC. You know, Oregon, like some other states, been on the leading edge of legalizing all of this without us doing the research. We need to change the federal law so we can do the research on marijuana and get a better understanding of what's going on there. Because this stuff, from CBD oil to THC to all these devices, all this being marketed as the latest thing to cure everything that's problematic. So in this case, I just want to make sure we're not doing more harm than good, that we're not pushing people into the illegal market, and at least have the secretary make that determination, or at least consider it as part of the effort they have to look at when they're looking at these products. So with that, Madam Chair, I yield back the balance of my time.
The gentleman yields back.
I certainly would, yes.
The chair recognizes herself as strike the last word. I think that this amendment delays action until the FDA has studied the impact on the black market. And I'm against it because it delays action. I don't think we should be conflating things today. The underlying bill moves forward. What it does not do, and we agree on the THC and the vitamin E, the acetate in that, we have to take something up on that, and I committed to Dr. Bouchon that I would work with him on that. I mean, the Surgeon General said, we must take action now to protect the health of our nation's young people. Now, we had testimony about flavoring. We had testimony about that. And as I recall, it was from someone who has spent his adult life studying it at the University of California. Now, when the Surgeon General stated these words, that was 11 months ago. So now we're going to do a study to study something. That's what's in the amendment. Now, let me finish. So I'm concerned about the black market, THC vapes that are hurting people, and we need to address that. But I think that what's tucked into your amendment is this study to study something. And most frankly, I'm not for that. I think that we have a crisis on our hands, and we need to move on it. We need to act now so that we can stop children from becoming addicted to nicotine through e-cigarettes. So I don't, unfortunately, I don't agree with you on that part of what you're saying. The THC piece, I do, but that's not really what your amendment does. I'd be happy to yield.
I appreciate that. Because what we're saying is that the Secretary has to consider whether the denial of the marketing order or substantial equivalence order for the electronic nicotine delivery system would increase the likelihood that individuals will purchase illegal or adulterated products on the black market, just to consider it. And I think that's pretty important.
Just reclaiming my time. What is in your amendment relative to menthol? What are you doing with that?
There's nothing related to menthol.
There's nothing in it?
No.
Nothing on flavoring?
It's very simple. It just says the Secretary, as part of denying a marketing order, just takes this issue into consideration. Will this drive people? I think it makes sense. We'd want to know, is this going to drive people into the black market where we don't want them to go? That's all this does, is take it into consideration. It's not an attempt to delay by any means.
Yeah. Well, it may not be your intention, but I think it's the outcome. Does someone want to use the remainder of my time or not?
I can. I was going to use my own, but I'll gladly take your 2 minutes. I don't really, I'm kind of reluctant to add to what you said, Madam Chair, because I think you said it so well. But I think that what my problem is that what Mr. Walden is saying with this amendment is quite a big deal. It's not a study. I mean, if he just said the FDA has to do a study, that would be one thing. But he's actually saying that in reviewing whether or not these products would still be allowed to be manufactured and sold, that they have to consider this black market option. And the problem with that is exactly what Ms. Eshu said, which is that if you include this amendment, it would mean that the FDA would have to consider what I call a very nebulous, ambiguous, and highly speculative analysis of whether a product could be available on the block market. And I think that's going to just, as she said, create more delay, more difficulty to say that these kinds of products can't be sold. You know, remember that in the bill, we still permit a pathway for flavored e-cigarettes to come to the market if the FDA determines that the flavored product is not any more harmful than a non-flavored product, that the flavor will increase the likelihood of smoking cessation among current smokers, and it will not lead more users, including youth, to initiate these products. So, admittedly, as Mr. Walden said, this is a high bar, but it should be, because all of these factors point to these products being on the market only if a determination can be made that these products will not increase harm to users. See, what happens is, and again, you know, I'm going back 5 or 6 years when I went around to a lot of these middle schools and assemblies and talked to kids, is that, you know, they think, and people who use e-cigarettes think that it's not harmful at all, and that the flavors, you know, don't make it matter, and that there's no nicotine, and there's nothing wrong with any of this stuff. Now, of course, time has shown that that's not accurate. I think I used all your time, so maybe I'll yield back and then ask for my own time if I could.
Madam Chair?
Is it our,
The,
oh, it's the Republican time?
yes,
Okay.
it is.
I'm going to strike the last word and
The
yield to
gentleman is recognized.
Mr. Walden.
I thank the gentleman. I thank the gentleman for yielding. I just want to go to your underlying bill and look at page 9. If you go to the bottom, there are all these things that the Secretary has to take into consideration, including whether or not this will significantly increase the likelihood of smoking cessation among current users of tobacco products. That's a consideration, right? You have that in the bill. The next thing is that it will not, the Secretary has to take into consideration whether or not it will increase the likelihood that individuals who do not use tobacco products, including youth, will start using any tobacco product, including electronic nicotine delivery system. That's a requirement under your bill. And then such electronic nicotine delivery system is not more harmful to users than electronic nicotine delivery system that does not contain any characterizing flavors. Your bill already requires the Secretary to look at that. The only thing I'm doing here is saying, can you also, as you're looking at that, consider if the decision will drive people into the black market, where we know, according to the CDC and others, that's where the really dangerous, even more dangerous things are happening. So I got to tell you, I'm actually kind of surprised at the pushback on this, given all the other considerations that are already in the underlying bill on pages 9 and 10. All we're saying is add another one that just says, look, also consider whether denying these things will drive people into the black market.
Would the gentleman yield?
It's Mr. Upton's
Oh,
time.
Glad to yield.
Look, I want everyone to understand, I don't want to have these exceptions, right? In other words, as far as I'm concerned, we shouldn't even allow the tobacco. I would prefer if the tobacco companies couldn't come back and make these arguments and continue to sell this stuff. The problem is this. They're saying, the tobacco companies are saying, wait a minute, Congressman Pallone, we really are the good guys, and we really want people to stop smoking, and that's why we started with e-cigarettes, because this is a way of getting people weaned off of nicotine and not having to become addicted and all this, what I consider largely nonsense. I don't really trust them. I mean, I'll be honest with you, right? But let me finish. But you know, if there is a possibility that you can sell something that actually weans people off a nicotine or, you know, cigarettes or tobacco in a fair way, then okay, give them the opportunity to come in and say that we have a product that will actually do that, all right? But I still want it to be as high a bar as possible, because I'm worried that they're bad actors, that they in the past have said to the public and their advertising and to kids, well, don't worry, this isn't going to get you addicted. This isn't really nicotine. This is safe, right? So I'm just concerned, and those are all public health things that you ticked off there, you know, that the FDA would have to look at, and it is a high bar. But now if you add something else about black market, it's going to make, I just think that it's just going to delay the process. It's a very ambiguous, notion about what we're going to do and what to consider. And these guys make a lot of money, and they have an ability to go to court and drag this on forever. So all I'm saying is I don't want to add another thing that's just not really health-related, to be honest, to ask the FDA to consider when they're looking for this remote
If I might
possibility.
reclaim my time, let me yield back
Does that
to
make
Mr. Walden
sense?
to
Okay.
I appreciate that, but no, it doesn't make sense.
Well.
Because there's nothing that, there are a few things that we've heard about in this committee on this issue that are more dangerous to public health than the black market use of these devices. That's what we've heard from the CDC. It's vitamin E, it's THC oil or whatever. That seems to be an even bigger problem out there. And all this does, you're going to do whatever you want, you got the votes, but it just seems to me that considering having the secretary also take a look at this public health issue of diversion, we don't want to push people into the black market. That's all I'm trying to do here. I was the only non-smoker in my family. I've been fighting tobacco in school since I was student body president of my high school and got it out of the bathrooms we went to the school board and got smoking out of the bathrooms. You had to get a permit, your parents' signature, and pay a fee and operate a smoke area outside. That was in the 70s. I was a progressive then on these issues. And so I just find that this is offered in good faith to try and get at this issue of the illicit market, which I thought we all felt was necessary under public health, but I yield back.
I'm very Catholic. I think I just heard a confession. Good for you. Yes.
I'll ask to strike the last word.
Yes, the gentleman from the chairman of the full committee is recognized.
Well, I heard the ranking member say he was a progressive, and I was very pleased to hear that. Maybe I misunderstood, but what'd you say? In the 70s. Oh, in the 70s. Oh, not now. Okay.
Then he learned to read and write.
I didn't understand. Well, I think you're a little progressive. I wouldn't totally deny that. But look, I understand what you're trying to do, and I'm just concerned that my bill narrowly focuses on the ability of tobacco companies to come in and say, look, we're offering this flavored product, and it will be less harmful. It will help cessation. Blah blah blah. The problem, though, is that I think I'm not trustful of that. So we've created this very high bar, and I just think that if you talk about the black market, this is something that historically the tobacco companies have used to try to get us not to regulate. So let me just mention this, and then I'll stop or yield to my colleague from California. Two prestigious bodies, the National Research Council and the Institute of Medicine, looked at this issue in their 2015 report, and they concluded that industry's estimates about illicit trade in the black market, quote, tend to be inflated, and that their concerns, quote, about the quality and transparency of industry-funded research on the illicit tobacco trade. The fact is that tobacco companies have consistently exaggerated the risk of a black market in order to discourage governments from implementing effective tobacco control measures. In looking at the impact of a potential product standard on cigarettes, the report found that demand for illicit versions of them is likely to be modest. So it is, in fact, true that these bad actors, because I consider them as such, have often used this risk of a black market in order to discourage us from implementing these control measures. So that's why, maybe they said it better than me, I don't want this added as another factor that would have to be considered. I yield to my colleague from California.
Thank you, Chairman. I think that you hit the nail on the head. The underlying assumption is that barring flavors or vaping will push others into a black market, and therefore it is safer to keep kids using regulated or vaping products than creating the condition in which they will go to the black market. Well, we have to look at the data and the public health approach to realize that before vaping came to its full force, you didn't have kids going to the black market. In fact, the problem with vaping now is that you've created new addicts of young people who are most prone to be addicted. And it is the addiction that moves young people who first taste it with flavors into the black market. And then, in addition to that, 40% of never-before nicotine users who are now vaping, 40% of them are actually turning into combustible cigarettes. So we're actually, the whole idea that vaping is supposed to keep people from tobacco use is actually not true. Vaping is a youth epidemic, and the public health approach is to reduce risks comprehensively so that kids don't get addicted and get vaping products from any source, whether it's black market or whether it's from a store. So I think that we have to keep in mind that the idea that making it difficult for kids to get flavored vaping products is going to somehow push them to a black market is safer is a false notion and is not aligned with public health standards or any scientific method at this point. And it seems to be, as the chairman said, a push from vaping nicotine companies as a messaging way of trying to say that it is safer than, one, tobaccos and combustible cigarettes, and two, it's just safer to keep them from going to the black market. Well, when in fact it's the regulated version that gets them addicted, that pushes them to the black market to begin with. And I yield back my time.
I now yield back, Madam Chair.
The gentleman yields back. If there's no further debate.
Madam Chair, strike the last word.
The gentleman from New Mexico is recognized.
Thank you, Madam Chair. And I just wanted to add a little bit to what Dr. Ruiz was just sharing. The CDC, with their recent research, shows that it's the acetate, that it's also all of the other carcinogens associated with those chemical compounds, too many to list, many of which that I can't pronounce, that are also part of this problem. And it's not simply in the illicit trade. This is in what's being sold legally in America. And for there to be a notion that this is not in what's available over the shelf at a local convenience store, the $50 starter pack that was being peddled and being sold for $5 at a discount to Native American communities, creating more and more addicts, the quickest rise to an addictive substance in our nation's history. That's the problem. And then lastly, the only thing that I'll add to this is there's a lot of conversation about THC here. It's not the THC. And any of my colleagues don't want to work together to remove cannabis from Schedule I, I'm happy to work with you so we could research this more at the federal level. Maybe we could tackle that one too. Thank you, Madam Chair, and I yield back.
Gentleman yields back. If there isn't any further debate, we'll proceed to a vote on the amendment. All those in favor of the amendment will signify by saying aye. Aye. Those opposed will signify by saying no. No. In the opinion of the chair, the noes have it. The amendment is not to agree. Yes? Did you? Do you want to record a vote? You're all right? Okay. Thank you. The amendment is not agreed to. Are there further amendments to the amendment in the nature of a substitute? The gentlewoman from Florida, Ms. Castor, is recognized.
I have an amendment at the desk.
What is your amendment labeled?
You have
It
it?
is.
We have it, ma'am.
Okay.
Amendment 1.
Amendment to the amendment in the nature of a substitute to H.R. 2339, offered by Ms. Castor of Florida. Page 3, line 20. Strike.
Without objection, the reading of this amendment will be dispensed with. Gentlewoman is recognized for 5 minutes.
Thank you, Madam Chair. Members, Congress needs to take strong action to stop the marketing of tobacco products to children, to end the e-cigarette epidemic among our youth, and be mindful that we do not sweep in a narrow set of disparate products that could imperil our important efforts. In 2009, this committee and Congress passed the Family Smoking Prevention and Tobacco Control Act, which provided the Food and Drug Administration with authority to regulate certain tobacco products that are marketed to kids. In the midst now, 10 years later, of the e-cigarette epidemic, Chairman Pallone and Congresswoman Shalala have introduced the Reversing the Youth Tobacco Epidemic Act, which will strengthen the FDA's authority to regulate certain tobacco products marketed to children, particularly the insidious e-cigarettes that have swept the country in the decades since we passed the Tobacco Control Act. The legislative intent for both efforts is rooted in the important objective of preventing youth access to tobacco products and stopping activity by big tobacco to develop a new generation of consumers by preying on our kids, particularly when it comes to the vapes. Now, for many years, many of us have worked with FDA and stakeholders to ensure that the very small subset composed of traditional handcrafted premium cigars that are not used or marketed to children are not swept up in overbroad regulation. We've introduced bipartisan legislation this Congress, as we have in the last 4 Congresses. That's how long we've been working on this. That very narrowly tailored effort reinforces the legislative intent of the Tobacco Control Act and narrowly defines the traditional, non-flavored, handcrafted premium cigars that are not marketed to kids. And I'm offering it today with the strong support of the bill's co-author, Congresswoman Shalala of Florida. The FDA's own science underscores our legislative intent. FDA and FDA-funded reports have found that traditional handcrafted premium cigars are not marketed or used by children in any significant way. A recent report published in the New England Journal of Medicine, written by the Center for Tobacco Products and funded by the FDA, demonstrated no correlation between traditional handcrafted premium cigars and underage initiation of tobacco products. In addition, a U.S. Center for Disease Control and Prevention, Morbidity and Mortality weekly report confirmed that premium cigars are smoked infrequently, reflecting their lack of addictive nature for everyone. So the committee may not be aware that based upon the congressional intent and the data, during FDA's tobacco control rulemakings, traditional handcrafted premium cigars always receive distinct treatment. For example, in the FDA's 2014 proposed rulemaking, the agency gave traditional handcrafted premium cigars distinct treatment. Furthermore, in 2016, the FDA announced an advance notice of proposed rulemaking for traditional handcrafted premium cigars, in part because of the FDA's acknowledgement that this narrowly tailored subset these products were often not marketed to children. In fact, former FDA Commissioner Dr. Scott Gottlieb had expressed an interest in reexamining any inclusion of the small subset of the traditional non-flavored premium cigars in the agency's deeming rule. So it's important to ensure that we don't make the mistake of drafting an overbroad bill by sweeping up this small subset of traditional handcrafted cigars that are not marketed to kids, as we move forward with the vital regulation of the dangerous vapes and e-cigarettes. Instead, I strongly support doing all we can in the Pallone-Shalala bill to tackle the scourge of e-cigarettes, vapes, and flavored products that are wrongly marketed to young people and children. And I want to make sure you all understand, we're not exempting cigars from the age requirement. This would be the first time, if this amendment is included, that all cigarettes would be cigars, even the handcrafted, hand-rolled cigars, would not be allowed to be sold to anyone under age 21. It would also want to make sure it's clear, this very narrowly tailored amendment does not apply to any type of flavored cigar, cigarillos, little cigars, or any of the mass-produced machine cigars. And again, the co-author of the bill, Representative Shalala, supports this amendment.
Does the gentlewoman yield back? Is there anyone that would like to speak to the gentlewoman's amendment? Mr. Bouchon, you're recognized.
Yeah, briefly, just for the record, that one cigar is approximately a pack of cigarettes from a medical standpoint, and although I don't disagree with the amendment, I think to be intellectually honest and be someone that, like myself, that promotes people to try to not use these products, I think that should be made clear. It seems like this is a parochial amendment for a specific industry. I understand that. But from a medical standpoint, one full cigar is about a pack of cigarettes from a use of a tobacco product standpoint. I yield back.
Gentleman yields back. The chairman of the full committee, Mr. Pallone, is recognized.
Thank you. I oppose the gentlewoman's amendment, but I would be open if she would withdraw it and not vote on it at this time to consider her concern when we go to full committee. Let me just say a couple things, though. I guess as I think I said in my opening statement, I've been concerned about this issue of e-cigarettes and vaping and targeting of young people with flavors for some time. And when the Trump administration or the president came out and said that, they were going to issue regulations that are similar in many ways to this bill, I was very happy. But I had been very critical of the fact that the FDA over the years hasn't, although they have the authority, didn't do a lot of the things that are in this bill. And now I'm concerned that they may not do them even though they said they will. So my hope with this legislation is that we don't take away any of the FDA's authority with regard to deeming tobacco products, but rather, limit, legislatively do the things that they should have already done. So my concern here with the gentlewoman's amendment is sort of along the lines of what Mr. Bouchon said, that, by limiting the FDA's authority with regard to cigars, even if it's to a very limited extent, the way the gentlewoman expresses, we're doing kind of the opposite of what I was trying to do with this bill. The idea isn't to limit the FDA's authority. The idea is to push the FDA to exercise that authority when they should. So for that reason, I'm opposed to the amendment, because I do believe that it carves out and says that the FDA can't do certain things with regard to cigars. But I also understand, as was mentioned by Ms. Castor, that one of the chief co-sponsor of this bill, Ms. Shalala, approached me and said, look, what my real concern here is the small store, wherever it is, doesn't have to be in Miami, it could be anywhere, that, hand rolls these very expensive cigars and, sells them, to someone who walks in and wants to buy this stuff. Not talking about online sales, not talking about machines, but really just that circumstance. And I'm not opposed to us addressing that. And if the gentlewoman would be willing to withdraw the amendment between now and the full committee, we'll try to craft some language that would deal with what she and Ms. Shalala are concerned about. Because, Ms. Shalala is obviously the former Secretary of Health and has been very much opposed to, very much out there trying to regulate tobacco. So I would like to, I think we can come up with something that would address the concern that you have. It's just that right now, I am also concerned about the fact that, this may be much broader than what's being proposed. And we actually did get an analysis from the Campaign for Tobacco-Free Kids this morning that said that, and I'll just read a little bit of it, it said that this amendment would prohibit FDA from regulating large and premium cigars and defines these cigars broadly, permitting certain inexpensive machine-made cigars to qualify for an exemption. and manufacturers that have strong incentive to modify their products or how they are made in order to be exempt from FDA oversight. I'm not saying, Ms. Castor, that I agree with what the Campaign for Tobacco-Free Kids is saying, but it does express the concern that I have. So
Will the
I would
gentleman
ask
yield?
yeah, I would yield, certainly.
Well, I appreciate the chairman's willingness to examine this issue, and I would ask the other members of the committee to engage as well. Look at the definition. It is a definition that has been crafted over many years to be as narrow as possible for a very small and distinct subset of the premium cigars that are not marketed to kids and in fact backed up by a lot of data from the agencies with that. So thank you, Chairman Pallone, and I agree to withdraw the amendment.
Thank you. And I yield back, Madam Chair.
The gentleman
Chair.
yields back, and the gentlewoman withdraws her amendment. Is there, yes, the gentleman?
Madam Chair, on that point, I like the amendment and look forward to the work that's done on that. But I also, see former Chairman Bliley looking down on us from his portrait up there, holding his pipe, and I'm just wondering if we could also work on some language for pipe tobaccos, which is generally an old man form of tobacco use as opposed to children. I understand we want to stop children from using it, but it just seems to me that some of your premium pipe tobaccos would also be affected by this bill.
Well, I think more
Respond to
than
the
anything
gentleman.
else, I just want to say something. We're here to protect everyone, really. I mean, obviously, the children of our country, we don't want a whole new generation of addicts, but this is about everyone. So I served with Mr. Bliley, and I have to say that when he found out that the tobacco companies had lied to him, that was a different Tom Bliley on the other side of that issue. And I remember it very well, and I always will. And it's an act of courage on his part, and he exercised it. Mr. Pallone, did you want to be recognized?
I don't really have anything to add. I don't even remember that he smoked a pipe, to be honest, but I guess the is he holding it in that portrait?
I thought he had the gavel in his hand.
Yeah, I thought so too. That's a gavel or his pipe?
That's a pipe.
Oh.
Oh, all right. Well, I mean, I'm not agreeing to what you're suggesting. We can certainly talk, but I'm not agreeing to exempt
Let's
pipes.
agree that he was a Southern gentleman. He's a wonderful man, yeah. Okay.
We can agree on that.
We agree on that. Is there anyone else that would, that wishes to speak on the Ains?
Yes.
Yep. The ranking member is recognized.
I have an amendment at the desk.
I'm sorry.
The amendment?
Amendment to the amendment in the nature of a substitute to H.R. 2339 offered by Mr. Burgess. Page 14, after line 2, add the following new subsection. F.
Without objection, the
report.
reading of the amendment will be dispensed with. And Dr. Burgess is recognized.
Thank you. So this amendment will require the Food and Drug Administration to submit annual financial reports and performance reports to Congress for each fiscal year in which user fees are collected. This type of reporting is required for other user fee programs, so it's not new. The Food and Drug Administration has collected nearly $712 million in tobacco user fees in 2019, and the use of which is largely unclear. This report would make the use of such fees known. Just to be clear, this amendment would affect all user fees collected by the Center for Tobacco Control, both vaping user fees and traditional tobacco user fees. Currently, the Food and Drug Administration has the authority to report to Congress on the utilization and collection of user fees in its general reports on implementation, but this amendment would require the FDA to report on the collection and use of these user fees annually. And I Urge adoption of the amendment, and I'll yield back.
The gentleman yields back. I support the amendment. Is there anyone that wishes to speak to Dr. Burgess's amendment? Seeing none, all those in favor of the amendment will signify by saying aye. Aye. All those opposed? In the opinion of the chair, the ayes have it. The amendment is agreed to. Are there further amendments to the amendment in the nature of a substitute? All right, well, that's good. Okay. So we're taking up the Ains now. All right, all those in favor of the amendment in the nature of a substitute will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. And now, the amendment in the nature of a substitute as amended to H.R. 2339 is agreed to. The question now occurs on favorably forwarding H.R. 2339 as amended to the full committee. All those in favor of forwarding H.R. 2339 as amended will signify by saying aye. Aye. Those opposed? In the opinion of the chair, the ayes have it. We don't need a recorded vote. Okay, H.R. 2339 is amended, is forwarded to the full committee. Now, we are going to move on. The chair calls up H.R. 4995, the Maternal Health Quality Improvement Act of 2019. The clerk will report the title of the bill. Got it? Can someone give the clerk the bill?
I'm sorry, Madam Chair.
That's
I have
all right.
the bill. Yes, sir. Yes, sir. HR, excuse me, HR 4995, a bill to amend the Public Health Service Act to improve obstetric care and maternal health outcomes.
Without
and
objection,
for
the
other
first
purposes.
reading of the bill will be dispensed with. The bill is now considered as read. Without objection, the bill is considered as read and open for amendment at any point. I'd like to recognize myself to strike the last word to speak on the underlying bill. I would really like to call out all of the members that have been working on this. Obviously, Congresswoman Kelly has been at the forefront of this issue, this entire issue relative to maternal health. I want to recognize Congressman Engel, Bouchon, Torres Small, Lotta, Adams, and Stivers for introducing the Maternal Health Quality Improvement Act of 2019. This is a bipartisan bill that addresses the maternal health crisis, and I'm really pleased that it is bipartisan. It should be. In my opening comments today, I talked about the maternal mortality crisis, especially in rural areas. Rural mothers are 60% more likely to die, not just to become ill, but to die during or after having a child than mothers in American cities. It's even more dangerous for rural minority women, including Native American women. Fewer than half of rural women live within a 30-minute drive to a hospital with perinatal services, and over 10% have to drive 100 miles. 100 miles. I know none of the gentlemen can even imagine being pregnant, much less having to drive 100 miles to get to these services. So this bill closes the gaps by expanding telehealth grants and increasing training opportunities for medical professionals so that the care that's needed in rural communities really does take place. The bill also expands programs that improve the practice of maternal care across the country. And the testimony that we had from the mother who had lost her daughter, a highly educated individual, but people were just talking past one another, and she lost her life. The bill authorizes and funds the Alliance for Innovation on Maternal Health. It's called AIM, A-I-M, which includes provider, public health, consumer groups working at the state level to implement the maternal safety bundles. So this is an important undertaking. We keep saying that we're here to improve lives. This will actually save lives. And so it does build on the bipartisan work our subcommittee has undertaken over the past 2 years to improve maternal care in our country, and it deserves the vote, I believe, of every member of our subcommittee. And with that, I'd be happy to yield time or recognize someone for full time. The chair is pleased to recognize the gentleman from New York, Mr. Engel.
Thank you, Madam Chairwoman. I move to strike the last word. Thank you, and Chairman Pallone for including the Maternal Health Quality Improvement Act in today's markup. Our nation is in the middle of a maternal health crisis. Every 12 hours, an American woman dies from a pregnancy-related complication. That's a shocking statistic that amounts to nearly 700 mothers lost each year in the United States of America. We also cannot forget about the 50,000 women who have a near-death experience while giving birth or during pregnancy. As Dr. Elizabeth Howell from Mount Sinai Hospital in New York City testified before the subcommittee on September 10th, these health outcomes become more disconcerting when they are broken down by racial groups. In New York City, African American women are 8 to 12 times more likely to experience a pregnancy-related death than white women. The bipartisan Maternal Health Quality Improvement Act, which I introduced with Representatives Stivers, Torres, Small, Beauchamp, Adams, and Latta, would create and improve existing public health programs to address the ongoing maternal health crisis. This legislation includes $65 million in annual funding for the creation and expansion of perinatal quality collaboratives, better known as PQCs. These organizations are on the front lines of this crisis. PQCs bring together diverse stakeholders to develop programs to address the underlying causes of maternal mortality and morbidity. The New York State Quality Collaborative, for example, has developed resources to address the leading causes of maternal death. These materials have been distributed to over 126 birthing hospitals in New York State alone. I urge members on both sides of the aisle to support this bipartisan legislation and bring an end to this public health crisis. Thank you, Madam Chair. I yield back the balance of my time.
The gentleman yields back. The chair is pleased to recognize Dr. Bouchon.
Thank you, Madam Chairwoman. I want to thank you and Ranking Member Burgess for bringing up this important piece of legislation. Additionally, I am pleased to see that a bill I introduced along with Indiana Representative Andre Carson, H.R. 4215, the Excellence in Maternal Health Act, it was included in H.R. 4995, the Maternal Health Quality Improvement Act of 2019. This bill establishes a competitive grant program to identify, develop, and disseminate maternal health quality practices that provide for better quality outcomes. In addition, the grant program would support training at health professional schools to reduce and prevent discrimination and implicit biases and enhance federal efforts to establish or support perinatal quality collaboratives. As a physician and father of 4, I understand the importance of ensuring the health of mothers during pregnancy and after the delivery of newborns. This is a critical time for both the mother and the child as a new life is brought into the world. We must do better in our approach across the entire nation, especially in rural America, to use best practices and provide the necessary resources to stop preventable maternal mortality. In fact, even as a physician, I was shocked by the data on this issue. I believe this bipartisan legislation will benefit patients and communities that are currently struggling, like those in my home state of Indiana, which has the third highest maternal mortality rate in the country, by providing them the support and training they so desperately need. Thank you again to the committee for prioritizing this bipartisan legislation on such a critical issue. I urge my colleagues to join me in supporting H.R. 4995. And lastly, I ask unanimous consent to submit for the record a letter from Representative Andre Carson supporting the Maternal Health Quality Improvement Act.
So ordered.
Thank you, Madam Chairwoman, and I yield back the balance of my time.
The gentleman yields back, and we all thank you for your leadership on this. And I can't help but think, as I often do, that our subcommittee is really blessed with representation of doctors. And we gain so much every time one of you speak, even though it's interesting that you disagree sometime, but that's all part of our work. Okay, are there any, yes, the gentleman from Massachusetts, Mr. Kennedy, is recognized.
Madam Chair, to strike the last word. And I wanted to thank you for bringing these critical bills before the subcommittee today. I wanted to reference briefly, as I had to step out a little bit earlier, that whether it's protecting children from early access to tobacco or reining in drug prices or increasing access to care for mothers, these bills will change lives in communities across our country. Specifically, the two bills that are before us at the moment, maternal health bills, we are considering the Maternal Health Quality Improvement Act and the Helping Moms Act, represent a long overdue response to a crisis in our country. It isn't enough just to be outraged that the United States has the highest maternal death rate in the developed world, or that the wealthiest nation on earth should be able to accept that African American women are 3.3 times more likely to die during childbirth than a white woman. It isn't enough to tell a mourning husband or a grieving parent or a scared mother who barely survived childbirth that we hear them and see them. Because words without action mean nothing in the midst of this crisis. These two bills are a first step forward towards real, tangible action. We cannot pretend that they are even enough. We must increase access to midwives and doulas, especially in underserved communities. We must invest in perinatal quality collaboratives that can improve the quality of care in neighborhoods around the country. And we must require implicit bias training for providers at all points of care so that no woman is silenced or ignored because of the color of her skin. Our work didn't start today, and it's not going to end today. This fight is too important. Thank you, Madam Chair. I yield back.
Gentleman yields back. The chair, yes, the chair with pleasure recognizes the gentlewoman from Indiana, Mrs. Brooks.
Thank you, Madam Chair. I move to strike the last word. I'm pleased to see strong bipartisan solution on the issue of maternal mortality. As I've mentioned in past hearings, I was really shocked and disappointed that my home state of Indiana, that we just heard about from my colleague, Dr. Bouchon, has some of the worst rates of maternal mortality in the nation. It is far higher than the national average. And in fact, as my friend, the gentleman from Massachusetts just mentioned, we have one of the worst rates in the Western world. And in fact, women in Iraq and in the Gaza Strip have a better chance of surviving childbirth than women in 33 of my counties in Indiana. We have 92 counties, and 33 counties have horrible rates. While my state has made some changes to improve maternal health, because we're so fortunate that our state health commissioner is an OBGYN, and Dr. Box has put tremendous focus on this. We have a long way to go. I'm very pleased to see the introduction of the bipartisan H.R. 4995, Maternal Health Quality Improvement Act. This legislation will create new programs to strengthen maternal health quality and access to care in rural areas. Those are the areas that I was talking about, that I represent. New programs to address racial and ethnic disparities in maternal health outcomes. And I think the hearings that we've had on this have just been heartbreaking as we've heard about the racial and ethnic disparities, and new grants to implement best practices in maternal health care and strengthen training programs, particularly for our medical professionals. So it's critical we continue to work together to improve maternal health and save the lives of American mothers so they can take care of those American babies. With that, I yield back.
Gentlewoman yields back. Are there, yes, the chair with pleasure recognizes the gentlewoman from New Hampshire, Ms. Custer.
Thank you, Madam Chair. I'd like to strike the last word. Thank you, Congresswoman Eshoo, for bringing this critical legislation to our committee today. As we heard in September during our legislative hearing on maternal mortality, 3 out of 5 pregnancy-related deaths are preventable. And when you really dig down into the data, we find what many of us already know. There are substantial maternal health disparities for those living in rural America. Access to care in rural states like New Hampshire is increasingly difficult for pregnant women and new moms. Fewer than half of all rural counties have a practicing obstetrician or gynecologist. I want to thank my good friend and colleague Robin Kelly for her leadership on this issue over the past 3 years, and my colleagues who bring forth this legislation, the Maternal Health Quality Improvement Act of 2019. This bill will create a rural obstetric network grant program to help women in rural areas access much-needed care and foster collaboration between health facilities that have obstetric care and those that do not. It would also ensure that maternal health providers are eligible for telehealth grants. Telehealth is key for rural health care and can be a difference maker in pre- and postnatal care, as well as in labor and delivery. In rural communities that experience extreme workforce shortages, having access to telehealth during labor and delivery helps with something as simple as real-time documentation to something as serious as recognizing the signs of hypertension and preeclampsia. This legislation is especially impactful for Granite State families and communities across rural America. And with that, I yield back. Thank you.
The gentlewoman yields back. Is there anyone on the Republican side that would like to speak to the bill? Anyone else on the Democratic side? The chair recognizes with pleasure the gentlewoman from Florida, Ms. Castor.
Well, thank you, Chairwoman Eshoo. I didn't want the opportunity to go by to compliment our colleague, Congresswoman Robin Kelly, for her outstanding efforts here. And the entire committee, I was reflecting on the very impactful hearing that you held, Chairwoman Eshoo, and what we heard from witnesses was very concerning. We are in the midst of a maternal health crisis here in the United States. What we have learned, mothers that have prenatal care have healthier pregnancies. If a mom doesn't have consistent care, they're 3 times more likely to have a low birth weight baby. They're 5 times more likely to have a baby that dies at childbirth. And these kind of problems continue after delivery. It's particularly troubling that the United States is among the most dangerous developed nations in the world in which to give birth. 22,000 babies die every year. That means every 12 hours a woman dies as a result of complications from pregnancy. This is a true health crisis. And I wanted to thank the committee for particularly focusing on the role of Medicaid here. Coming from a large state like Florida that has not expanded Medicaid, yes, of course, Medicaid covers probably most of the births in my state, but what we heard from witnesses here that we still have so much room to grow. There is an unfortunate implicit bias that goes on for women of color, that they are not taken seriously, they're not heard by their health care providers, and that must change. And hopefully this package of bills will move us in the right direction, but I know Congresswoman Kelly's not going to give up, and we're not going to give up on this. Also, it implicates the fact that there are still too many Americans that do not have access to affordable health care. They simply can't get to the doctor. That's why all of the initiatives on Healthy Start, everything the March of Dimes is doing, all of the education efforts of CDC are important, but we have to confront this issue of the implicit bias where women of color are not being heard, and hopefully this package of bills will move us in that direction. So thank you. I yield back.
The gentlewoman yields back. Anyone from the Republican side have additional comments on the Democratic side? Any members wish to speak to the legislation. The question now occurs on favorably forwarding H.R. 4995 to the full committee. All those in favor of forwarding H.R. 4995 to the full committee will signify by saying aye. Aye. All those opposed? In the opinion of the chair, tough call, but I'm going to make it. The ayes have it. 4995 is forwarded to the full committee. The chair now calls up H.R. 4996, the Helping Medicaid Offer Maternity Services or Helping Moms Act of 2019. The clerk will report the title of the bill.
H.R. 4996, a bill to amend Title 19 of the Social Security Act to provide for a state option under the Medicaid program to provide for and
Without
extend
objection, the
continuous
first reading of the
coverage.
bill will be dispensed with. The bill is now considered as read. Without objection, the bill is considered as read and open for amendment at any point. The chair is pleased to recognize the ranking member of the committee, Dr. Bouchon. I'm sorry, Burgess. Doctors with Bs.
Thank you. This amendment will fix the provision. Oh, I beg your pardon. Call up the amendment.
Amendment to H.R. 4996 offered by Mr. Burgess of Texas. Amend subsection C of section 2 and read as follows.
Objection, the reading of the, without objection, the reading of the amendment will be dispensed with. The gentleman is recognized for 5 minutes.
This amendment will fix the provision regarding the temporary increase in the federal medical assistance percentage for states that utilize the state option for postpartum mothers. H.R. 4996 applies this temporary increase to only the first year following the implementation of the law. This amendment improves upon this idea, but applies this temporary increased FMAP for any year in which the state makes use of the program. For example, states in which the legislatures only meet every other year, as in Texas, there is only one session every 2 years. Under the introduced language, Texas could not receive this temporary increased FMAP if they opted in when they are back in session in 2021. The temporary increase in the FMAP serves the purpose of incentivizing states to establish and make use of this option and ultimately to increase care and coverage for pregnant women and mothers. Without this correction of language, states would lose the incentive in the years following the implementation of this bill. I will say, too, that I do like us to consider, and I generally would not support a bill that failed to properly include a provision offsetting the cost. So, Madam Chair, I hope that by the time this legislation comes back to us, it includes an offset for the cost of this policy, and I hope I can count on your commitment to ensure there is such an offset before we take this legislation to the floor.
Yes. We will pay for it.
And I appreciate that. CDC has found that 1 out of every 3 pregnancy-related deaths occurs between 1 week and 3 years after, 1 week and 1 year after birth, with more than 40% of the births in the United States covered by Medicaid. The underlying bill, H.R. 4996, could have a significant impact on addressing rates of maternal mortality and morbidity. Thank you, Madam Chair. I encourage my colleagues to vote for the amendment and for the underlying bill, and I yield back.
Can I ask,
Gentlemen.
can I have part of your time?
Yes. Be happy to yield to the gentleman.
Just to ask a question. So, essentially, most states are going to take this. So essentially, it's a 5% FMAP bump for everybody, right? Ultimately, is that the reality of it?
The increase in the FMAP is to encourage states.
Right, and I can't imagine a state wouldn't take this. It's a good idea. So the reason I asked that question, I kind of knew the answer. The reason I asked that question is I would agree with you that we do need to look for offsets. This is going to be a permanent 5% FMAP increase, probably for almost every state.
And right now, for example, in Puerto Rico, the FMAP's 100%. And there's also a disparity between states, as you know, and the percent of what the FMAP currently is. Some states have as high as maybe 70% federal funding, whereas others may be lower than 50%. So I just want to agree with you, Dr. Burgess, that before the final version of this bill comes around, we all need to recognize there needs to be some sort of offset. This is a permanent increase in the federal funding for the program. I support the concept, but I do think we need to look at the funding.
Will
I yield.
the gentleman yield?
Let me reclaim my time.
And will the gentleman yield?
Just to be clear, number one, I don't think any state has an FMAP lower than 50%, so I think that is the floor. And this is for 1 year. And I recognize that the gentleman's concern that it could end up being continued longer, but this legislation actually covers 1 year. The reason for the amendment is so that states that have a legislature that only meets every 2 years would still be able to participate if they are not, if their legislature is not meeting in the year that this is available.
Yeah, can you yield for a second? I just want to point, I want to quote one of our former presidents in saying there's nothing more permanent than a temporary government program. So, I can't imagine that at any point that states will decide not to do this and give up the 5% FMAP. That's my I'm not saying I don't support it conceptually, I do. But I do think we need to be realistic and know that we're going to have to find some funding offsets. I yield back.
And that was the purpose in the colloquy that established that we will have an offset before coming to the floor.
The bill would be paid
Madam
for
Chair?
before going to the full House. On the Democratic side.
Madam Chair?
Yes,
I'd like
the
to strike-
gentlewoman
I
from
move to strike the last
California,
word.
Ms. Matsui is recognized.
I move to strike the last word and yield to Ms. Castor.
Yeah, I just want to make a quick point based upon the recent March of Dimes report card from 2019. Of course, the offsets are important to pay for things, but when we're talking about pregnant women and children, they say for every baby that's born prematurely, it costs the state around $65,000. So it's probably cost us less to actually do something to prevent these things from happening in the first place. I yield back.
I yield back.
Do you want to yield to Mr. Kennedy?
Yield to Mr. Kennedy.
Thank you to my colleague from California. And Madam Chair, I would ask if you'd be entertain a colloquy.
I'd be happy to.
Thank you. Madam Chair, over and over again in this hearing room, we've talked about the stigmas of maternal mortality and mental health as distinct silos, stubborn barriers to care that lead to too many preventable deaths. But we haven't yet wrestled with the fact that those two stigmas are deeply tangled with each other. Because, quite simply, we haven't begun to understand how many mothers we lose to suicide after childbirth. It hasn't been studied nationally, and in the few instances where it has been examined locally, the statistics have been devastating. Mothers should not be forced to wait for more than a month before their first postpartum checkup visit, and those visits should not ignore their behavioral health. That's why I'd like to continue to work with you and the staff on an amendment for a full committee markup that would require Medicaid coverage for a postpartum checkup within 1 to 2 weeks in addition to the common 6-week postpartum visit, which would include evidence-based screening for depression, anxiety, substance use disorders, and any other behavioral health concern that a doctor would see fit. If we fail to see the mental and physical health as one, of our patients as one, we'll leave countless mothers without the care that they deserve. And so, Madam Chair, I hope to continue to work with you and any other colleagues that might be interested in getting this language right before we move it to the floor for a final vote.
I'd be more than happy to, and I think the gentleman raises a very important a point that traditionally there's the 6-week checkup, but I think statistics are, we need to pay attention to them. 2 weeks is really very important. So we'll look forward to what you're going to do on that, bringing it to the full committee. Excellent point. Is there anyone else that would like to be recognized?
Thank you, Madam Chair, and thank you to my
Yes, do
colleague
yield
from
back?
California. Yes, I yield back.
All right. That what? Is there anyone else that would like to speak on the gentleman's amendment? Not on the amendment, all right, so all those in favor, since there isn't any further debate, we're going to proceed to a vote on the amendment, correct? All those, on the Burgess amendment, all those in favor of the amendment will signify by saying aye. Aye. All those opposed? In the opinion of the chair, the ayes have it. The amendment is agreed to. Are there further amendments to the legislation? So are we're on the, so no further amendments?
No.
No further amendments. You want to speak to the underlying bill? Recognize Mr. Carter of Georgia.
Thank you, Madam Chair. Madam Chair, I'm proud to be one of the original co-sponsors leading on this bill to significantly improve maternal health care. Addressing the issue of maternal mortality is critical nationwide, but it's particularly important in my state of Georgia. I was shocked when I first discovered that Georgia had led the country in maternal mortality, and it immediately became a priority for me to find a way to help. Over the last year, I've held a number of roundtables in communities across my district to meet with experts and care providers. As we've learned more and more about the maternal mortality problem in our country, it has become clear how valuable postpartum care is to keeping mothers and their babies healthy. Over half of pregnancy-related maternal deaths occur after delivery. Access to health care after delivery has been tied to significant benefits to the mother's physical, social, and psychological well-being. As of 2017, the CDC reported that 43% of births in the U.S. were covered by Medicaid, and currently Medicaid only covers 60 days of postpartum care. As we have worked as members and as a committee to improve maternal health, we have heard resoundingly from our researchers and care providers that 60 days of postpartum care is simply not enough. Today, we address this problem by giving states the opportunity to offer postpartum health coverage for 1 year after birth. There is no silver bullet to our maternal mortality, but I do believe this is one of the single most important policy changes we can make to improve health outcomes for moms across the country. I can't think of many better investments to make than in the health and well-being of moms and their babies. So I'd like to thank Representative Kelly, my fellow original sponsors, and committee leadership on both sides of the aisle. Improving maternal health is something that I think we all are committed to, and I'm glad to see the Energy and Commerce continuing to lead the way on this important bipartisan issue. I encourage all of my colleagues to support this bill, and I look forward to continuing to work with you all to get this bill across to the President's desk. Thank you, Madam Chair, and I yield back.
The gentleman yields back. We thank him for his leadership on this. It's a pleasure to recognize the mama of the effort for several years, the gentlewoman from Illinois, Ms. Kelly.
Thank you, Madam Chair. Thank you, Chairman Pallone and Ranking Member Burgess. This markup represents a step forward in putting an end to the maternal mortality crisis in our country. In recent years, the number of American moms dying from pregnancy and childbirth has climbed drastically, while globally it has declined. New American moms are twice as likely to die than in 1985. After almost 35 years, the situation should be getting better, not worse. As with nearly all health disparities, women of color, especially Black and Native American moms, bear the burden of this crisis and continue to die at much higher rates. Black women, as you've heard, are 3 to 4 times more likely to die than white women. In some places, that disparity grows even larger, such as in my state of Illinois, where Black women are 6 times and growing more likely to die. While each death is tragic, the reality of the situation foretells more tragedy. According to ACOG's research, more than half of all maternal deaths are preventable. It's clear that we can and must do more to protect mothers' lives. As chairwoman of the Congressional Black Caucus Health Brain Trust and co-chair of the Congressional Caucus on Black Women and Girls, of prime importance to me is equitable healthcare access and delivery and the healthcare system's impact on those who historically experience barriers to care, whether due to cost, geographic isolation, insurance coverage, and especially due to egregious forms of exclusion, such as race and the residuals of racism. The time has come for action. We've already lost too many mothers to this crisis, and there are too many kids growing up without moms because of preventable maternal deaths. Thank you, Dr. Burgess, for working with me on this critical issue. I'm glad we were able to push bipartisan legislation that is a step forward in the effort to give all moms the care they need and deserve. This bill will bring us closer to finally enacting a law to save moms from needlessly dying across our country by helping states extend access to care for the full year postpartum, which we know is a critical time period for new moms. It's incumbent upon us to honor the lives of countless mothers we have lost with action that will prevent another mother from needlessly dying or another family from being torn apart. But the fight is not over. We must continue to pass legislation that will advance equity and support the health of all moms by guaranteeing them access to the quality care they deserve. Thank you, and I yield back.
The entire subcommittee thanks you, Congresswoman Kelly. Is there anyone on the Republican side that would like to speak to the underlying bill? Democratic side? Hearing none, the question now occurs on favorably forwarding H.R. 4996 to the full committee. All those in favor of as amended. All those in favor of forwarding 4996 as amended to the full committee will signify by saying aye. Aye. All those opposed will signify by saying no. Hearing none, in the opinion of the chair, the ayes have it. 4996 as amended is forwarded to the full committee. The chair now calls up H.R. 2387, the Stop the Overuse of Petitions and Get Affordable Medicines to Enter Soon, or the STOP, S-T-O-P, Games Act of 2019. The clerk will report the title of the bill.
H.R. 2387, a bill to amend subsection Q of Section 505 of the Federal Food, Drug, and Cosmetic Act to clarify the process for
Without objection,
denying...
the first reading of the bill will be dispensed with. The bill is now considered as read. Without objection, the bill is considered as read and open for amendment at any point.
Madam Chair.
No amendments? No amendments. All right. Well, is it our side? Yes, our side. I'll recognize the chairman of the full committee, Mr. Pallone, to speak on behalf of the bill.
Thank you, Madam Chair. Today's citizens and manufacturers alike have the ability to file a citizen petition with the FDA at any time for any reason, and the right to petition the FDA about legitimate scientific issues is fundamentally American, and the process itself is one critically important way to facilitate information sharing with the agency. Public interest groups and manufacturers have used this process to alert the FDA to concerns about individual ingredients in consumer products or to share legitimate safety concerns about products. As we've heard in our work on drug pricing, some manufacturers, however, have abused this process and hidden behind this legitimate justification to file sham petitions meant only to delay generic drug approval. They've even raised seemingly valid regulatory issues in these petitions just to force FDA to reconsider the safety or efficacy of the generic product itself or standards related to that product to buy additional time. There was a recent example of such abuse which involved the manufacturing filing 24 citizen petitions with the agency for the purpose of delaying approval of a generic competitor. According to the FDA, and I quote, "These repetitive, serial, and meritless filings lacked any supporting clinical data, but the campaign had succeeded in delaying generic entry at a cost of hundreds of millions of dollars." Now, our committee has long been concerned with this issue of sham petitions. We first attempted to address sham petitioning in the Food and Drug Administration Amendments Act of 2007, or FDAAA, by allowing the FDA to delay approval of a generic only if such delay was, quote, necessary to protect the public health. And this legislation did not fully address our concerns about the delay of generic approvals, so we again consider this issue in the Food and Drug Administration Safety Innovation Act, or FDASIA, which this committee passed on a bipartisan basis in 2012. In each bill, Congress sought to expedite FDA's process to dispense with these sham citizen petitions, which are submitted with the primary purpose of delaying generic drug approvals. Our goal was to reduce the amount of resources FDA expends reviewing anti-competitive petitions and to ensure that such games do not delay approval of generic drug products which lower prices for consumers. While these legislative efforts help to improve this situation dramatically, additional clarity is needed to finally put an end to this problem. And prior to leaving the agency, former FDA Commissioner Gottlieb noted that the current process requirement for 505Q petitions adds to the resource burden on the agency generally and specifically on the generic drug review process. The current process forces the agency to spend finite resources on responding to these petitions, redirecting important resources away from the daily work of application approval. So FDA also proposed changes to the underlying statute that would help to address these concerns as part of the agency's most recent budget request, changes that are incorporated into the legislation before us today. So we have the Stop Games Act. It would require that FDA is able to exercise its scientific expertise to quickly dispense with citizen petitions that raise smoke and mirrors arguments and unnecessarily delay market entry of generic competition and do not raise valid scientific or regulatory issues. It also specifies the factors FDA should take into account when making a determination as to whether a petition was submitted for the primary purpose of delaying generic competition, codifying FDA's proposed approach and final guidance issued this fall. These changes to the existing statute have bipartisan support in the Senate. They passed the Senate Health Committee this summer. I support the legislation because I believe it will ensure that FDA's resources are focused on the review of generic drug applications, improve the agency efficiency in responding to petitions that do not raise valid scientific or regulatory issues, and will help remove yet another obstacle to competition in the marketplace. And I know my colleagues on the GOP side have suggested changes to this bill, but I worry that their proposed changes would undermine the important goals of the legislation. While I agree with my colleagues that we should maintain opportunities for public and private entities to raise scientific or regulatory concerns with FDA, I don't agree that this legislation would impede such opportunities. So, in fact, I believe that this bill preserves the ability of the FDA to act on petitions that raise legitimate public health concerns, concerns that would always take primacy, obviously, over potential delay of generic drug approval. So I would urge my colleagues to support this legislation to put an end to the gaming of the citizen petition process that delays generic drug approvals once and for all. And as you know, Madam Chair, we've been trying to deal with a lot of these obstacles to generic competition and legislation we passed, so this will be part of that. Thank you, Madam Chair. Yield back.
The gentleman yields back. Are there other members seeking to speak on the amendment? The gentleman is Mr. Griffiths is recognized.
Thank you very much, Madam Chair. I agree with the chairman when he says that we don't want to have, constant filing of new citizens petitions that are basically making the same argument. And there's a theory of law, res judicata, that says if you've had a full and fair opportunity to litigate, you don't get another shot. So I agree with that. And I think the principles of the bill are fine. I don't have any disagreement with the bill, but I do have some concerns that I want to raise, and hopefully we can work together on some of these. And the first one is the current standard for summarily denying a citizen petition currently has two prongs. One, the primary purpose is delay, and there's no scientific basis. So here's the dilemma that I have as a legislator, and I think y'all can appreciate this, particularly when you're in the minority. Your primary purpose might be to delay legislation, but you might also have a valid point that there's a problem somewhere in the bill. Now, in this particular bill, I'm not just trying to delay the legislation, but I'm pointing out that if you make the only test to be that the primary purpose is for delay, you're ignoring if that particular citizen petition has a valid scientific purpose behind it. Now, maybe they're just putting it into delay as a part of the issue or as a primary part of the issue. But the chairman said in his comments, and it was well stated, if it's a sham petition meant only to delay, I'm in complete agreement with that, but that's not what the legislation says. It says the primary purpose is to delay. Currently, it would also have to be no scientific basis. I think the FDA and others ought to have to take a look at if there is a scientific basis raised that has not been raised previously, they ought to have to look at that. Now, I think we can figure out some language on that that will make both sides happy, and I hope that we can work on that. And then I will confess, it's been brought to my attention that there is a principle called the Noor-Pennington Doctrine. I confess to you that I am not comfortable making any arguments on that at this time because I have not done my research into that. But it does appear on its face that there may be a problem with a longstanding Supreme Court practice or interpretation that protects First Amendment free speech related to citizen petitions and like matters, that says that you can't just throw it out unless, as the chairman stated, it's a completely clear that it's a sham meant only to delay. I want to research that further as we go to the full committee. I'll do my homework. I want to raise it today just so that everybody is doing their homework on the Noor-Pennington Doctrine. I'm going to read some Supreme Court cases, see how it affects this bill, and I will share my opinion later. But just raise it so that everybody can be looking at it so that when it is raised, or if it is raised at the full committee, it's not one of these deals where people think that I've sandbagged on you. But I will tell you that oftentimes I will, in an attempt to stop legislation I actually like this legislation. I'm just trying to figure out how to get my arms around it. I will sometimes raise an amendment. The primary purpose might be to delay or slow the process down, but I never raise an amendment that doesn't have at least a kernel of a problem in it. And so I just want folks to know that's exactly what we're dealing with here. If there's a kernel of a problem, FDA ought to have to deal with it. I yield back.
Will the gentleman yield?
I yield to the chair, the ranking member.
Thank you. And Ranking Member Walden mentioned in his opening statement that he was supportive of the underlying goal of this legislation, which is to prevent manufacturers from gaming the system by filing petitions that are primarily intended to delay generic competition. But there is a concern that this legislation would allow the FDA to summarily deny petitions that raise valid scientific or regulatory issues. Mr. Griffith has just enumerated that. So we are concerned it could be in direct conflict with protections provided by the First Amendment. So, Mr. Chairman, will you commit to working with us between now and full to address this concern?
Yes.
Thank you. Yield back to Mr. Griffith.
The gentleman yields back. Doesn't look like there's almost anyone left here, so. So we will now, let's see. The question now occurs on favorably forwarding H.R. 2387 to the full committee. All those in favor of forwarding 2387 to the full committee signify by saying aye. Aye. All those opposed? Was that a no? Sounds like it's a unanimous aye. In the opinion of the chair, the ayes have it. H.R. 2387 is forwarded to the full committee. Without objection, the staff is authorized to make technical and conforming changes to the bills consistent with the actions taken by the subcommittee today. And I now ask for unanimous consent to place the following documents in the record: a coalition letter in support of H.R. 2339, coalition letter in support of prohibition on menthol cigarettes, letter from the National Medical Association in support of H.R. 2339, letter from the NAACP in support of H.R. 2339, a letter from the American Cancer Society Cancer Action Network in support of H.R. 2339, a statement from the March of Dimes in support of H.R. 2339, 4995, and 4996, a letter from Advocate Aurora Health in support of H.R. 4996, a letter from Families USA et al. in support of H.R. 2387, a letter from Association of Maternal and Child Health Programs et al. In support of H.R. 4995 and 4996, a letter from Every Mother Counts in support of H.R. 4996, a letter from Shades of Blue Project in support of H.R. 4996, a letter from Women Heart in support of H.R. 4996, a letter from the American College of Obstetricians and Gynecologists in support of H.R. 4995 and 4996, a letter from physician associations regarding maternal mortality, letter from Black Mamas Matter Alliance in support of H.R. 4996, a statement from America's Health Insurance Plans in support of H.R. 4996 and 2387, a letter from 2020 Mom in support of H.R. 4996, a letter from the Center for Reproductive Rights in support of H.R. 4995 and 4996, and of FDA budget justification for fiscal year 2020. Without objection, the staff is authorized to make technical and conforming changes to the bills consistent with the actions taken by the subcommittee today. And now I'd like to thank everyone and the good work that has been done by so many members of this subcommittee. And now the subcommittee stands adjourned.